One's in Maine, so just two, I think. Maybe just one. I don't know. Maybe I might not be home. I don't know. It's going to be quiet, which is all right. Yeah. Because Thanksgiving was, you know, everybody was home with their boyfriends and girlfriends, and everybody was around for about a week too. So it was nice, and that was fair. Because then they got their other halves, you know, they got their other parts of the family and stuff.
We have to be back by the afternoon of the 30th, because she's having New Year's Eve in her apartment.
She's still in New York City? Wow. So she goes from Popple Dungeon to New York City. I mean, there's your two extremes.
Mm-hmm. What a great opportunity.
Yeah, it sure is.
What are you implying about Popple Dungeon? What are you implying?
That it's
about
opposite
Popple
of New
Dungeon?
York City.
Oh, yeah.
Can't get much more opposite.
I'm going to turn it down.
So 20 people did.
Okay, you go right ahead. You do it. Yeah. Wild and crazy, although it probably is, just at a different level. We have enough seats.
Come here. Sorry. Okay.
The sun is up, the sky is blue. It's beautiful. So
Yeah, I would say, is there anybody, I have a sign-in sheet. Is anybody not signed in? I'm gonna,
Right, okay. It also says that you've taken over, or somebody else has taken over doing the minutes, so is that still true? Under
What does
old
the-
business, it
Lee,
says select board
can you see what
minutes,
the
Amy owned by.
computer says for time?
if it could
computer?
do.
What
Have we got everybody?
Okay,
6:01.
okay. Do you want me to bring it up, or you take care of this one?
Who's calling? That makes it good.
See if anybody else did. I think so, yeah.
That's it, Julie. You want to go?
Go ahead.
It's a little after 6 o'clock, and I'd like to call the meeting to order. Can we all rise for the Pledge of Allegiance, please?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'd like to welcome everyone to our December 15th Select Board meeting. For all the people here in the audience, there's a sign-in sheet that is circulating around. Just make sure you get to sign it sometime during the meeting so we can keep it for our minutes and our records. There seems to be quite a few people on Zoom with us tonight. So it's going to be a hybrid meeting, and we'll do our best to accommodate everyone here. And that is also on Zoom also. Amy, I guess you can help me out with hands and things like that as we go along and stuff, because I don't hear that well and I can't see that far. So I've got some issues. The first item on our agenda is to approve our minutes from our December 1st Select Board meeting.
Make a motion to approve the minutes from the December 1st, 2021 Select Board meeting.
Second.
Lee is a motion and Lee is a second. Any changes, corrections, omissions, errors, anything on the minutes?
Well, I just noticed on line 22, instead of grid, it's grit, and that's been corrected, our hope. And also on line 79, just capitalize the last name of Jack. just a typo.
All right. Anybody else have anything?
Thank you.
All those in favor of approving the minutes as corrected, please say aye.
Aye.
Anybody opposed? Minutes are all set. Next item on our agenda is citizens' comments. If there is someone here or in our Zoom audience that wishes to address the select board on something, on an item that is not on the agenda, now would be the time to do so. And I would ask that you come up to the microphone and state your name and your comment. And is it okay, the board, that we allow the gentleman, he's from Andover, to speak?
Sure.
Yep.
My name is Scott Kendall. I'm a selectman in Andover, and we're here to ask if you guys have a contract for the emergency services.
So that's under old business. Do you want me to answer it now?
I didn't know, I didn't see
No,
the
it's
agenda,
okay.
so.
Do you want me to answer it now or answer it under old business?
Can you wait 2 minutes?
Wait, yep, that's fine.
Thanks, Scott. Are there any other citizens' comments?
This is off the agenda?
On any item that you would like to speak to that is not on the agenda?
Okay, is the mask mandate on the agenda?
Yes, it is.
Okay, so
Yep.
that's a
So that'll be the time to speak towards that issue when we have it on. Yep. Yep. Amy, nobody out in Zoom? No hands up?
Arnie?
Yes, ma'am. Please come to the microphone and state your name, please. It's for us here, but it's also for the folks that are,
No,
Zooming
mine is
in.
a simple question.
so just your name.
Jan Moot, can you hear me?
Okay, Jan.
There's a lot of speeding on North Street. Speeding?
Speeding on Main Street.
North Street,
North Street.
yeah. It's bad sometimes. I don't know, we haven't seen the policeman there that much. And there are children now.
Yep.
I don't know if that should be brought up now, but it's a good time to think
No,
about it.
anytime you would like to speak to the board regarding an issue, it's a good time.
Okay,
So, we can bring it up with the police department. We can make a message to relay to them about your concern, and hopefully there's something that you could do about it. Maybe do some extra patrol or some extra,
So
work there.
coming from the north on 103, we do have the speed sign there, right, coming into? The speed sign's not there?
they ignore it.
Well, no, I just want to make sure it's there, because
yeah.
that's a good way for us also
Yeah,
to try to
there is.
monitor that. So I was hoping it hadn't been taken away.
No.
Or moved to another space.
No.
So, okay.
Thank
And we also have one going north on 103, don't we?
There's one in front of my
Right before we
house.
get to the,
Yeah, right in
Yeah.
first. Around the corner, I think it is, isn't it?
Right by
Right.
First Avenue.
right by First Avenue, that's correct.
And there's one right across, right near my house.
Right, which is on the way out, farther out. It's at the end of North Street.
Also, yeah.
Yeah, perfect, good.
Well,
Thank you.
we could relay the message to the police department about your concern,
Okay.
and
My
hopefully-
neighbors have spoken of it, and I thought I'd bring it up.
Thank you.
Thanks.
Thank you. Are there any other citizens' comments? Come on up to the mic, Chair. Just give everybody your name.
My name's Jerry Usey. There was actually an accident tonight pulling out of Church Street on North Street. I think the speed sign on this end would actually work a lot better if it were on the other end. I don't think it's so much speeding from this side as,
You're talking about what, coming into town? or-
Yes.
There is one coming into town from 103, from
I think
Ludlow.
if it was further up, it would probably, and I understand there's highway there.
Because it goes to state highway, we
State
can't move
highway.
it up.
Where
farther.
does it change to highway?
Right at the produce place that's there?
Yeah. There's a lot of issues
Yeah.
on where we can or can't put signs like that.
It's where it's at because it has to be 400 feet within our boundaries.
Gotcha. I know from pulling out of Trebo every day, I take my life in my hands, so.
Wow.
I know, it seems like the novelty of those signs is starting to wear off now. And maybe with a sign there and the enforcement. I mean, it's hard to give somebody a second chance when they go through a radar sign that has your speed limit on it and then say, well, I didn't know, or I didn't this, or didn't
We
that,
need
so.
to be more vigilant, I think.
You know. But thank you. Any other citizens' comments? Hearing none, we'll go on to our next agenda item, old business. Julie, can you take us through old business, please?
I can. There's only a couple items tonight. First being Yosemite, we have put that on for the December 29th meeting. It's been challenging getting all four of us together with busy schedules. So we'll be meeting next week, and you'll have that update on the 29th. I had let you know that we have started the time management system for time clocks, and we're going to be switching to payroll. We're not going to make that change to the payroll system in 2022. It's taking us a little more time getting adjusted to this new system, and I don't want to hand everything off so quickly. So that'll be a 2023 item. And then the Andover contract, we're working on now. I have drafted, Jim is looking at. You guys will have this on your agenda for December 29th. Chris Plum, the chair of the Andover board, emailed me yesterday and asked if I could just put together what he called just a quick kind of memorandum of understanding that, that because this contract won't be signed by us and Andover prior to January 1st, something in writing for them, you know, acknowledging that we're covering. So I had responded to Chris this afternoon and let him know that I would be drafting something to send over to them. That answer your question? Okay.
That's it?
That's it for all
Scott, is that
business.
okay for,
Yeah, we were hoping we could get something for our meeting on the 27th.
Yeah, it's in attorney review at the moment, so.
you know, it's budget time of year, and it's good to have those numbers.
Looking for something that's internal.
Yep.
I know what
Yep.
I'm saying. You guys cover, you guys get it.
Oh, that I will definitely have to. I emailed Chris today, yeah, yeah.
Thank you.
You're welcome.
Is that it for your old business
That's
list?
it for old business for this time around, yeah.
Any board members have any old business?
I do want to say something, it's not really old business. The town hall looks great with the lights. The lights throughout the town on the green are fantastic. Some of the side roads, the stone. So anyways, it's a really festive little community, and I think it's looking great.
I agree. Totally.
I'd like to thank a lot of the people that are involved in that put up those
Well, thank
lights and
you
go
all.
through all the work to get them
Yeah.
up and stuff,
Yeah.
to do that for the town. I'm not sure who all these people are, the names, some of them are here,
Yeah.
A lot of them.
but there's quite a few that are
But
involved in
even
it.
some homes,
Yeah,
you know, and
yeah.
it's put me in the Christmas spirit, and I'm really appreciative.
It's a nice drive through town.
Yeah, it sure is.
Anything else on old business?
What?
At the speed limit.
Yeah.
Well, we used to have the sign that said naughty or nice, and then that got shut down. We're not allowed to make statements like that on our radar
really?
signs. Yeah.
I wish we could.
We only kept it on during the season. We
Yeah.
didn't
It
have
didn't
all the
matter.
time.
It
We
was
got
against
it-
some kind of
We
rules or
got a
regulations
threat
or
from Federal
something.
Highway Administration that is violation of,
It said,
it hit the
"Sorry."
Boston Globe, which drew the attention
Yeah.
of the Federal Highway System.
Curmudgeon.
Well, yeah, that's
Yeah.
true.
Yeah.
So
Darn, I
we
didn't
would
know
have,
that they
and you know,
shut it down.
we would have had grant funds withheld had we have violated, so we had to take it off.
Let's not do that.
And those signs are I appreciate those signs too, because, you know, it lets you know you're not doing it right.
It really helps, I think, it really does.
Anything else on old business? All set? The next item on our agenda is a discussion regarding a possible or potential mask mandate in the town of Chester. Over the last few weeks, we've received a lot of emails and phone calls regarding this question, which is why it is on our agenda, because we're looking for public input on this issue. I know it's a hot-button issue in the town. It's been a very divisive issue. There are a lot of opinions, ideas, and thoughts that are associated with this issue. I know some numbers are starting to rise, and we put it on the agenda, and we wanted as much input as we can get from the people of, the townspeople of Chester regarding this issue. So at this point, I would welcome anyone that has a comment or a consideration that they would like us to think about, or anything they would like to say regarding this issue, to come forward and speak their mind.
Mr. Chair, can I make a recommendation that we set a time limit? There are a lot of people here, and if everyone takes 10 minutes, we'll be here till midnight.
Usually it's 2 or 3 minutes. We'll try to keep track of it as best we can. If it starts, going on, we'll move things along. And we'll let everybody speak at least once that would like to speak. And then we will continue with our discussion as a board, and then we'll take it from there and we'll see what happens. So if there was someone that'd like to speak to the board regarding this issue, I'll recognize you, then you'll come up to the microphone. Kathy Pellett, please, you had your hand up first. We'll get everybody. Kathy?
Can you raise this up?
Yes.
Yeah.
I was going to suggest that. I wasn't sure you
well.
would want to, but certainly we don't have
Jeff?
No.
Yeah, Jeff, you'll get it to.
It's just that little crank right there.
Yeah, I think that's, thank you. First, I would like to thank the Select Board for giving us the opportunity to share our thoughts on a mask mandate. I'm not speaking tonight to change anyone's mind, but if I do, all the better. I'm speaking out mainly to say why I think a mask mandate is the right thing for the town to do. It would be great if we didn't need a mandate, if everyone would wear a mask simply because we've seen from last winter that masks work. Not only do they protect us from COVID, but they also protect us from the flu and the common cold. But here's the biggest reason why I support a mask mandate. As a society and as a community, we do things not just for ourselves, but for the greater good of the greatest number of people. This is not just about ourselves, but about everyone, including the most vulnerable people living amongst us. People who cannot get vaccinated for health reasons. People whose immune systems are severely compromised and are extremely vulnerable. And even people who are vaccinated, because we know that this new variant can affect everyone. When I think of the hardworking people at the checkout at Smitty's, who are also our neighbors, and this can be said for every store in town, why should they be subjected to other people's germs, whether COVID or a cold? Yet they are there every day serving us and taking a risk while doing it. This winter, our population will soar with skiers descending upon us. And how will we protect ourselves and each other without strictures which apply to all? No one likes to be told what to do, but we comply because we're instructed to do so by laws, public health laws among them. We wear a seatbelt. We drive within the speed limit. We put children into an approved car seat, and we get our children vaccinated for certain diseases so they can attend school. These are just some ways we do what we're told. We do this because we are compelled by laws designed to protect us, and the system cannot succeed with only compliance by some. When I was a state representative, I looked at bills we were going to pass into laws, and I tried to view them as doing the greatest good for the greatest number of people. And that's how I view a mask mandate. And maybe next year, or even sooner, we won't be having this conversation. Thank you.
Thank you.
Thank you, Kathy.
Thank you.
I saw some other hands up. Yes, sir?
My name is Andrew Pelletier. I've lived in Chester all my life. I think that when dealing with a topic that's so emotionally and politically charged, it's important to step back and view it with a lens of logic and common sense. When you do that, you realize something doesn't add up. The survival rate for COVID-19 is very high, somewhere around 99%. The vast majority of cases are mild or asymptomatic. We have vaccines and therapeutics available to anyone 5 years and older. The newest variant, which seems to be driving a lot of the discussion, is as mild as the common cold, and the guidance on masks has been very inconsistent from the beginning. The way we've dealt with this pandemic so far feels unsustainable. I've realized that a lot of the regulations that have come have been because people do not want to be liable for somebody getting sick. In the Commons recently, there was an op-ed written by Betsy Thomason. She's a retired respiratory therapist and author. Nurses and doctors rely on this field for knowledge and experience. She states, during my respiratory training, it was drummed into my students that surgical masks do not stop the spread of germs. They simply prevent large particles, say, from a sneeze, from entering the sterile surgical field. She goes on to say that N95s are the only masks capable of blocking microbes, but require annual training on proper fitting and are not designed for continual use. Not to mention they are expensive and in short supply. I can attest to some of this from my own personal experience from when I took an OSHA 10-hour certification class. I remember there was a section on dust masks and respirators. To meet the standard, there's specific information to know about each of the mask designed application. One thing is you cannot have facial hair for risk of breaking the seal. This includes stubble and light beard. As stated in OSHA Standard 29, employers shall not permit respirators with tight-fitting face pieces to be worn by employees that have facial hair that comes between sealing surface and the face piece of the face. Also, on the OSHA website, right now, under the frequently asked questions about cloth face coverings, it states that they are not considered personal protective equipment and they are not appropriate substitute for PPE. You know, I could go on all day. A lot of it feels as though that the public health crisis isn't necessarily, you know, it goes far beyond COVID-19. I think that, you know, I can't be responsible for the person down the street from me who doesn't care about their health, or the countless people I've seen walk out of a public restroom without washing their hands while wearing a face mask. There's a lot of things that we're missing as a society, and there's no hiding from it or eradicating it. Coronavirus has been around for a long time, and we need to remember how to live with respiratory illnesses again. They mutate so fast, it's impossible to keep up. Zero tolerance for sickness is not feasible. It's a part of the human experience and helps us build a strong immune system. I mean, honestly, if it comes down to it, for me, it is about personal freedoms and everything like that. I don't think that the town or the government should necessarily be instilling on us how we should live. And it's because I believe that it's a very slippery slope. And, you know, the more, you know, I don't have a Facebook, but from what I've heard and made a bit aware of, there's a lot of rhetoric out there, and there's a lot of postings against people in our community, and what it does is it creates two, you know, barriers of people, two different, you know, classes, essentially. And in history, when you see that happening, that's not a good thing. You know, when you have people split up saying, oh, you're on this side, you're on this side, but at the end of the day, we're all neighbors. And I think that we're capable of making decisions, what's best for us and our families. So, yeah, I don't think, obviously, that we should mandate masks in the town. Thank you.
Thank you, sir. In a second, what I'm going to do is maybe let someone on Zoom offer, speak out. Amy I think I see a hand up there, and then we'll get back to the folks here.
Okay, it says Hayden A, which I'm assuming it might be Michael Allen. I'm not sure.
Michael, are you out there?
I wonder if it's Hayden Allen's his son. I don't know if he logged in.
I don't know. Well, if I don't have a response.
There he is.
I'm here.
Okay.
Can you hear me now?
Can you give us your name and go ahead? You've got the floor.
Mike Allen. Forgive me, not a big Zoom guy. But can you guys hear me all right?
Yep, we can hear you.
Yes, we can.
Okay, perfect. Yeah, thank you everyone for your time. I know it is a sensitive subject. We are divided. And there's a bunch of different ways you can try to get around this with the COVID, getting vaccinated, washing your hands, wearing a mask. But if a small business owner gets COVID, a lot of small business owners are the only people that are running their business. So we're not just talking about getting COVID or, not dying. We're talking about our income, our livelihood of trying to survive in an already difficult year, in an already difficult situation. It's nice. So Ludlow mandated it, which is great. I'm really excited about that. This early in summer, we went to Portsmouth, New Hampshire, and it was very unified to go into a town and have a unified feeling and know what I was expected to do, and that was to wear a mask. And by having the town mandate it, it's going to take the pressure off small business and to allow them to make a living, to survive in our town. And by us unifying a mask mandate in town, people that are visiting, people that live here will be knowing what to be expected of them. Whether people do it or not, that's another thing. But I do think a mask mandate in town, what it would do, whether people are going to wear them or not, whether it's going to be enforced or not, I think people need to realize it's still happening. All summer long, when the numbers started to rise again, people would come and I would talk to them. They had no idea that the numbers were surging again because, quote unquote, I thought Vermont was the safe place to go, where I thought Vermont was still safe. It hasn't gone away, and people have gotten very laxed. And just by having a mandate, maybe it'll help someone think twice about how they're going to interact with their fellow neighbors, as far as distancing, as far as trying to keep our community safe. Chester, Vermont has a tagline, is the Vermont you've been hoping to find. I'm kind of hoping the select board tonight will make it the Vermont, a safe place, and the Vermont you've been hoping to find. I know it's a hard decision, but I would appreciate us being unified as a front and letting the message be clear that there's still things that are out there that we need to deal with. Thank you.
Thank you, Michael.
Thank you, Michael.
Is there anyone here? Sure.
Yes.
Steve Mancuso, you might want to tell him he has to wait.
What's that?
Steve, hang on a second, okay?
We're going to get someone from the floor, Steve, and then we'll go back to Zoom for you. Hang in.
Yes, sir.
Okay, hi, I'm Vicki Thornton. I don't live in town, but I own a business here in town. So I don't think you should put a mask mandate. A store owner or a small business owner can put their own mandate on their own business. We don't need somebody to tell us to put a mask mandate up. I think that it should be left up to us. They are our storefronts, and for those of who want a mask mandate, they can easily put a sign up, mask required. I have a sign on my door that says mask strongly suggested. 99% of people wear a mask coming into my store. I don't think the mandate is necessary to go through the board. Thank you.
Thank you, Ricky. Steve, Mr. Mancuso, you out there?
Yes, sir.
Go ahead, Steve.
Okay. First of all, the actual OSHA passage is 1910-1030, and which a mask is only a part of, Arnie. You have to realize that, if you're not addressing the whole protocol, a mask is really just half a helmet. But all sciences aside, I would back up the last speaker and just recommend the board be suggestive of medical advice instead of demanding medical advice, because you place the town in a bad position of liability here. Just imagine those, I'm sure you know that the medical community and the legal community the litigant community are very much symbiotic in the sense that one follows the other. If you demand a medical practice and it doesn't work out for people, it may not work out for the town of Chester. Just consider that. Thank you.
Thank you, Steve. Just hang in, Lee. Nick?
Thank you, and thank you for providing us this opportunity and for thinking about this. As you know, Cavendish, Ludlow, and Wethersfield has recently passed various forms of mask mandates. I think the only argument I really hear anybody saying, which you made reference to, is the freedom issue. Well then, okay, let me drive down Route 11 at 90 miles an hour instead of flashing little signs saying I'm going too fast. This is a public problem that needs public solutions. If we say, oh, I'm taking care of myself and my family, I hope my neighbor will, we're all each other's neighbor, and it's obviously clear that whichever variant it is, it's spread through the air, and this helps. I really hope you will take this truly minor step, which it is. It is not an infringement of our freedoms. Thank you very much.
Thank you.
Hang on a second. Thank you, sir. Yes, ma'am? And just give us your name.
Yeah, you can, I think you can
Pull it down.
I think the mic, or you can
size
take the mic
It's all right.
off.
fit
I
all.
think you can hear me. My name is Renata Sawyer, and I live in town. I own a business, not open door business, but it's a business in town. One of my biggest thing with the mask mandate that it really doesn't make any sense on my mind. As an example, if I go to our little cafe, Southern Pie Cafe, and I walk in there with a mask. Place my order, but I decide to sit down to eat. At the moment I sit down, I can take my mask out. It's a small room, and we're all breathing that room. My neighbor next to me, sitting maybe 6 feet apart, also eating without a mask, because you can't do it with. So we are inside of a small establishment without a mask eating. If I get up to go to the restroom of a restaurant, if I'm at the Pizza Stone or the pub, I'll put my mask. But if I sit down, I take my mask out. I am still breathing the same air. So it doesn't make sense. I also think that it should be, yes, I think freedom is a big thing. I think we should have the right to choose if we want it or not. If you have your vaccines, if you be respectful. Well, I heard a lot about being respectful to your neighbors. If you are sick, don't leave the house. Stay home. I think that's the best manners, and show respect to your friends, to your neighbors. So that's my point. I think it really hurts the business. I own a business. If I go inside of my client and they say put a mask out and I have to sweat my body for 4 hours working, cleaning their house, I said, I'm sorry, I can't do it at your house. I can't do it. I can't breathe that way. So if I'm not feeling well, I'm going to stay home. I'm going to say, I'm not coming today. And I expect that my client look at me and say, I'm not feeling well. Please don't come today. So I think respect starts with your attitude, not with the mandate attitude. So that's it. Thanks.
Thank you, Ms. Sawyer. Amy, anybody out there? No?
Not right now, no.
Burley?
Oh, Tim Roper, just,
All right.
Hang on.
Tim Roper.
No, go ahead. I'll get him next.
Okay.
Yep.
Hi, everybody.
Hi.
Burley Sunflower. I don't live in town. I own Erskine's Grain and Garden, just up the street here. Certainly conflicted about this one, right? On a personal level, I do take this whole virus very seriously. I have issues, respiratory issues, and ask my family and everybody I know to get vaccinated as soon as possible, and I wish that everybody would do the same. I think there should be mandates for that. I don't think there should be mandates for a mask, or at least not as that mandate is written. I struggle with how it will be enforced. I struggle with the fines associated with and the responsibilities on the business owner to enforce it based on those. I struggle with the sunset provisions and when it would go away. None of us here have any insight into when this virus ends. I certainly don't want to be telling customers they have to wear a mask in a week. I agree with a lot of people, some of the people here that have spoken that there shouldn't be a mask mandate. But again, personally conflicted because, you know, I hear arguments on both sides of freedoms and of personal health and things like that. And I tend to fall in the camp that should be wearing a mask or should be vaccinated. But as a business owner, I don't think it should be our responsibility to do that. And the reason I bring that up is, you know, we worked really hard at Erskine's to enforce the state mandates. We enforced them after they went away because our staff wasn't fully vaccinated. We had some kids on our staff that couldn't get vaccinated until long after the state mandate went away, and we enforced them really hard to make sure that our staff was safe. And then when we felt comfortable as a business, we decided to let that mandate go away. During that time period, I got told to F off multiple times, and I'm tired of that. I trust the people that come in my business to do what's right. As a business owner, I do what's right for my customers, and I try to treat everybody as they should be treated. And I know a lot of the people in this meeting, a lot of people in the community, come to our store and trust us, and we trust them to do what's right. And that's all I would ask, that we be able to continue doing that rather than deal with another mask mandate.
Thank you, Mr. Sunflower. On the Zoom side, you said Mr. Roper was waiting? Yes. Tim, go ahead. Can you hear us?
Yes, thank you. Can you hear me?
Yes, we can.
Go ahead, Mr. Roper. Yep, we can hear you.
Okay, thank you. You know, I just want to start, I've been pretty vocal on this topic, and I want to start out by saying that my passion about it is coming from a place of caring. I've heard a couple of people say this is divisive. I've heard the word bully being thrown around. I don't feel that way at all. I care about all of you, and I hope that you all care about each other and that I'm on that list as well. This question of masking is only coming up because we do care. So I just want to make sure everybody knows that's where I'm coming from, and I feel that I hope that everyone else is coming from that position of caring as well. That said, I also think there's something that not everyone fully understands, that wearing a mask to protect from COVID, from our droplets, is not to protect us. When I hear it should be my right to choose whether to wear a mask or not, that's where there's a little bit of a disconnect. Because my mask protects you, your mask protects me. So that's why this becomes a public health issue, and I think that's the reason that I am in favor of a mask mandate, because not everybody understands that. Maybe they don't want to, maybe they just can't, I don't know. But it's a key point that I don't think has been brought up yet tonight, and it's an important one. You know, wearing a mask isn't a hard thing to do. You go in the store, you put on your mask on the way in, you come out, you get in the fresh air, you take it off. We're not asking a lot. And yet, we still need to prompt people to do it. Another point is that anyone can be asymptomatic, whether we are vaccinated, boosted, or not. Anyone could be carrying this virus and not know it. So to say that if you don't feel well, stay home, well, sure, but how do you know? You can be spreading this virus for days before you feel any symptoms, if you ever feel any symptoms. One of the benefits of vaccinating is that the symptoms should be mild. You can still get the virus, but your symptoms should be, hopefully, more mild. I know that's not the case for everyone either. So I just ask that the select board, I know this is a hard issue, and I ask the select board to please step up, make the hard choice, and institute a temporary mask mandate for public buildings in Chester. Thank you very much.
Thank you, Mr. Roper. Second. Garrison?
Garrison Smith. I own Smitty's in town. Try to keep it relatively short. Just as a basic level, I'm not supportive of a mask mandate. And that's as somebody who adopted a mask requirement 2 weeks before the state required it 15, 17 months ago. At the time, that was the right decision. We made that decision as a business in consultation with a number of my key employees. Right now, we're not requiring masks. We've had some debates about it. I'm here tonight after talking to a number of my employees, and right now, we're of the view that we don't want to require it. We want to encourage it. We have most of our employees wearing masks, but it is a little bit up to each of them as individuals. I don't think it's fair to put the burden on every one of the businesses to enforce a mask mandate. I think it's right for each of them to make their own decision for what's right for their own business. There's a lot of different views about do masks work, not work. To put somebody at the register in the middle of enforcing it is simply wrong. So that's about it.
Yes, in the back row there. Just.
Hi, my name's Patty Goyette. I'm from the Fullerton Inn. I agree on the aspect of all business owners that are here. It's not a lot to ask somebody to put a mask on when they walk in, but to ask an employee to wear one for 16 hours when it's not their preference or when it's not good for them, that's a lot. Asking us to monitor everybody that walks in, put your mask on, you can't come here. So I am all for personal choice. You choose to wear a mask. Some of my employees choose to wear a mask. Some don't. I am not for a mandate at all. Thank you.
Thank you. Sir, in the back there.
Ian Montgomery, a resident of Chester, and I am speaking very much in favor of a mask mandate from the town of Chester. I am part of that 1% that have died. That means anyone over 65, according to the Times earlier this week, has died of COVID. That means 80,000 extra people have died of COVID. It seems to me that that's a fairly significant statistic, and I would have to say that I would regard it as an item of caring for older people, that you would put in a mask mandate. I know young people are not concerned about dying, and maybe I'm not either because I know where I'm going. But it seems to me that if we're a caring community, we wear masks. And, you know, if I have to choose between two stores and I see someone inside one with a mask, I'll go in that store, not the one where someone isn't wearing a mask. I'm changing the subject. I got an email this week from a member of our Rotary Club. He's saying he's not coming to Chester anymore because our infection rate is far too high and he's afraid of coming. This man is in his 80s. Without an underlying condition, he can hike up hillsides and mountainsides that have me dying on the first quarter mile. It's, do we really care about the community, or is it all about me, 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 and my freedom? You don't have the freedom, anybody here, to give me COVID. Thank you.
Thank you, sir. All right. Mr. Harrington?
Hello, Lee Harrington, Chester resident and a part-time employee in Chester. listened to all the other comments, and one of the points that I've heard consistently for folks that are for the mandate is to protect our elderly, protect the people that are at risk next to them in line or in a store. I've researched a lot of the statistics around masks. There's a high failure rate. Depending on the study, some studies have come out saying cloth masks are only 20% effective in stopping particles. Surgical masks are higher. N95 is very high, but not 100%. So when you enter a store being an at-risk person and you see everybody masked up and you feel, okay, I'm going to be safe, that's not necessarily the case. Next, we don't have any enforceable standards for masks if we adopt a mandate. Mask could be an N95, it could be cloth, it could be a surgical mask, it could be made of sequins and stop nothing. And nobody knows it. Sequin masks are you can buy them, and nobody's going to know whether that's the mask being worn next to you in a store. So I think those 2 points show the mask mandate creates a false sense of security to our at-risk population, and our at-risk population needs to have it reinforced for them that whether a mask is worn or not, they are not safe out in a public place. They need to be vaccinated and take personal protective measures to protect themselves. Anecdotally, looking at how our country has fared against COVID, we've had mask mandates all over the place. I was in Springfield and Claremont today. Mask use there in both places was upwards of 80, 90% in the stores, yet the virus is still flourishing. Is it only flourishing because of the 10% of us who aren't wearing masks all the time? I doubt that. I'd go back to looking at the failure rates. I've heard reference to safety and speed limits. We don't set our speed limits in town at 20 miles per hour everywhere. That would be the safe thing to do. We set something a little more reasonable. You go out 103, it's 50 miles per hour with traffic coming at you at 50 miles per hour. We take an acceptable amount of risk in driving our roads here. We have, I read somewhere, somebody pointed out about seat belts and safety standards in vehicles and vehicle inspection. We enforce vehicle inspection here, but you can walk in with a car built in 1965, and as long as the brakes function as they were designed in 1965, your car is legal on the roads here, even though that car is much less safe than a new car. We don't make people go out and buy new cars here. I moved to Vermont because it's a more libertarian society. I appreciate those values here. I feel at home here, and I'm against the mask mandate for all of those reasons. Thank you for your time.
Thank you. Thank you, Mr. Sawyer.
Yeah, how you doing? Thanks for having us. I just want to say that I am against the mask mandate. I would respect any business that wanted me to wear a mask in their establishment. If all they have to do is have the sign say it's required, and I will abide by that. But I don't think it should be required by the town. It's not required by the state. It's not required by the federal government. And when we talk about things like driver safety, those things are required by the and mandated by the federal and state government. This is kind of cowboy, legislation, in my opinion. So I'm against it.
Thank you, Mr. Sawyer. Amy, is there anybody out on in Zoom?
I don't think so. Penny Benelli keeps unmuting herself, so I'm not sure if she wants to speak or not.
Who's that?
How do I wave? She keeps unmuting herself, so I don't know if she wants to speak.
She's waving. Here she is.
Ms. Benelli, would you like to speak to this issue?
Yes, I would. Thank you.
Go ahead.
I'm in favor of a mask mandate because there is absolutely no question that masks work. They're not 100%, but every doctor, every medical person out there, the CDC says they work. They stop the spread of this disease. COVID isn't, I heard it compared to a common cold. This has killed 800,000 people in just over a year, year and a half in this country. 800,000. The common cold didn't do that. The flu didn't do that. And this is going to keep on going until and unless we stop the spread of it. It's going to keep mutating. We got the Delta variant that's killing people still. Now we have the Omicron. It can only survive if it spreads. If it doesn't spread, it goes away. It has to find a new host. It has to keep going. It has to spread. Masks stop the spread. Not entirely, but they slow it down so much that is a major factor. Vaccination is another major factor, but that's not what we're talking about today. If you're not going to get vaccinated, you have a chance of getting it and dying from it and spreading it. But if you're not going to be vaccinated, but you're going to wear a mask, at least that's going to help protect other people from around you. You take your own risk by not getting vaccinated, but you are spreading it to everybody else anytime you go out into public without a mask. We're not asking that people wear masks 24 hours a day. You don't have to wear it in your own home. You don't have to wear it in your car. You don't have to wear it outdoors. But when you go into public spaces with other people, public town government spaces or public stores, the risk there goes up dramatically. It is a simple thing to wear a mask when you go in there. And if there's a rule that says everybody in this town has to wear a mask if you go into town, as some of our neighboring towns have done, people are going to go there because it's a safer place to go. If you have somebody coming in, skiers, you know that after the foliage, Vermont had a surge in COVID. We had people from all over the country showing up here, and sure enough, Vermonters got sick. With the ski season coming up, that's going to happen again. And frankly, if somebody wants to come into Chester who's not vaccinated and doesn't want to wear a mask because he or she feels free to do that and wants to spread COVID in this town, sorry, we don't need that person. Our businesses don't need that person. It isn't going to help the town of Chester or its business or its schools or any of the people here. This is something, it's a community effort. We can't do it one at a time. We have to do it as a group. It works. We are slowing it down dramatically with masks. It's so important. It's the way to save lives. It's the way to stop this pandemic. And I hope that the town of Chester will impose a mask mandate in this town.
Thank you, Ms. Manali.
You're welcome.
Amy?
There's somebody on here,
Pixel 6. Pixel 6, can you please give us your name and go ahead and speak?
Hi, yeah, my name is Jesse Bailey. In my view, I heard it mentioned, masks aren't 100%, and that should be enough reason to not require them. And in my view, seatbelts aren't 100%. You could be in an accident wearing your seatbelt, and you might still be severely injured. You might die. But does that mean that seatbelts shouldn't be a requirement? And if this governor said it were up to towns to decide if they wanted to require seatbelts, would Chester not require them? And I also heard it mentioned that wearing masks give people a false sense of security. I think medical experts would disagree with that, but even if it gives that sense of security and that there's a chance that it's preventing something, I appreciate that sense of security. I like having that sense of security when I go into a business, when I go into a restaurant, where I don't have to worry if because there's not a mandate, my server is not wearing a mask out of eyesight because they don't feel like it, and therefore putting my health at risk. I've avoided a lot of restaurants because there's that question in my mind, and and to have a mask mandate would alleviate that, would make me feel more comfortable in going out. And also, someone said that they would respect any business that would require masks. But there are plenty of videos on the internet where someone walks into a business and they're told they should wear a mask and they don't, and they fight. So great for that person who would respect that, but a lot of people are going to put up a fight. And to have a mandate gives more force, more legal ground to that business owner or employee who wants to say, well, you know, sorry, it's not our decision, it's the government's, if that makes them feel more comfortable and makes them feel more confident in you know, saying, please wear a mask in our business. For their own health reasons, for the health reasons of employees they have. You know, so it's, I don't see a tangible downside to requiring masks. You know, if people want to say it makes them feel less free, you know, that's just a feeling. But to not have a mandate might mean people die, might mean people, you know, struggle for the rest of their lives with complications, just because, you know, some people don't want to feel like they have to wear shoes, shirt, and mask into a business. That's my feeling toward it, and thank you.
Thank you. Hang on a second, Scott.
I have two people on here that want to speak, so I don't know if you want to go back out there and then come back here.
We'll do one online again.
So Kathy Matrasha.
Kathy, can you hear us?
Are you talking to Kathleen Matrasha?
Go ahead, Kathy.
Hi. I have to say I agree with the previous two speakers wholeheartedly. We're not just talking about people who are in their who are relatively young and in great health. We're talking about not only the elderly, but also the children too young to be vaccinated. And we're not just talking about business, but I understand the emphasis on businesses. A lot of economics are involved in this, but also the meeting that you're in right now. This is a public building and a public meeting. Churches, any kind of place that people are congregating, masks, according to the CDC, according to all the medical evidence, masks work. Do they work 100%? Obviously not, but they help. And we need help with this horrible virus that is killing people, killing more than 800,000 people in our country. And we know also that 15% plus of Vermonters are not vaccinated. And a lot of people coming into the state for various reasons, we don't know if they're vaccinated or not. We need to protect ourselves, yes, but we need to protect each other as a community. So please, I request that the select board, votes to pass at least a temporary mask mandate that gets us through the entire holiday and New Year season and ski season, and protects us all as a community. Thank you very much.
Thank you, Kathy. Go ahead, Scott.
I'm Scott Blair. I own two businesses here in town. I have the Southern Pie Cafe and Down to the Roots. I also coach our community for our sports, and I'm also very active in our community to help out the community. I am very against having a mask mandate in this town because it should be the personal business owner's choices. I have no problem going to, for say, right now, Sage Jewelry, they have a mask mandate. Okay, if I want to shop in their store, I will go in their store. If I want to put a mask on is when I will shop there. If I do not want to put a mask on, I will not shop there because that is Michelle's choice. If people come into my shop, they're going to know whatever makes them comfortable and whatever they feel is safe and healthy is what I decide for them. that they get to decide. I'm not the one to decide that if they're coming to my business, and that's what my choice is. We have been told since COVID has started that let's get vaccinated, let's get masked, let's get the vaccine percentage in our state above 80%, and everybody's going to be amazing. Okay, guys, what are we at now? When is enough enough, and we're just going to be able to live our life again? I have multiple businesses on the green. I help out all of our kids. I'm coach, so I have to mask up to coach. Am I against that? No, because that is what I'm being asked by the community that I'm working for. I have staff in my businesses that have told me themselves, I do not want to be masked. If I have to mask back up because of a mandate, they will not work for me. Because they feel more comfortable now being able to show our customers their smiles. They feel more comfortable not having to approach a customer that comes into my cafe, which did happen before, saying to my girls, I don't want to put a mask on. Okay, so what are they going to do? You guys are going to mandate it, and somebody comes in and we said, we're being told to put it on. So we're supposed to call the police every single time? No, because guess what? You guys, people want to sit here and explain Ludlow, Cavendish, surrounding towns have a mandate. You can look in everything, you can listen to all of their meetings that they've had. They are unenforceable rules is what exactly they put in their rules. That's their mandate. So I could go up to Ludlow right now, and I could go into one business that has mask mandate on it, and I don't have to wear a mask if the business owner doesn't feel comfortable there. So we're wasting time. I feel this is all a waste of our time because we should be able to live our lives, and for the select board, they have a lot more to worry about right now than an unenforceable rule. That's how I feel. That's also how multiple business owners feel. I've been told to name these business owners. It's not my responsibility to list those business owners, but I'm on the green and I'm very active in this community, and I hear a lot of input from a lot of people. Thank you.
Go ahead, Mr. Need.
Thank you. I just wanted to say that we've been in this pandemic for almost 2 years now, and it's been extraordinarily hard on everybody. It's been hard on individuals, communities, businesses, but it's also been exceptionally hard on young people. It's been 2 years, and if you're 10 or 13 or 18 or even 20, 2 years is a big piece of your life to put on hold. And our young people have been denied opportunities for education, socialization, recreation. We've seen a rise in depression and anxiety among young people. And the thought of this 2-year pandemic turning into a 5-year pandemic or a 10-year pandemic is just heartbreaking when we think about our kids. And as a parent, I think we have an obligation to our community to do everything we can. And everything doesn't mean that the parts of everything are perfect. It doesn't mean that they work all the time. But the science is clear that it does help. And I think we have an obligation to do everything we can to try to slow the spread of this virus and bring this pandemic to an end, so our kids, young people, can have a reasonable shot at a decent quality of life and to be able to grow up in something closer to normal. So I would really support a mask mandate in the town of Chester. And I heard comments previously, and I've seen them online, about concern about if we have a mask mandate, when does it end, that kind of thing. I would suggest the select board consider a 30-day mask mandate, a trial, and revisit it at the next meeting. And if it turns out that it's just untenable, it doesn't work, it doesn't help, there's too much opposition, don't renew it. So that's what I have to offer, and I appreciate the opportunity. Thank you.
Thank you, Mr. Need. Linda Dyack.
Right there.
Thank you. My name is Linda Dyack. We have a business here in the village, and first I would like to tell the select board, I'm sorry that you have to do this. I think our state should have done this, and I know it's difficult, and I appreciate that your willingness to take it up. I'd like to thank Mike Allen for his point about small businesses. If we go down, we go down. And in the meantime, we shoulder an awful lot of cost. You know, every month we have to make, produce, and sell close to $6,000 worth of goods just to pay our health insurance. Our costs have risen a lot this coming year. We're going to be putting $22,000 out of pocket for just for the insurance, not for what we're, you know, deductibles and stuff. It's been hard, but we know that masks work. There's enough science now, there's enough data to know that masks work. We know that mandates work, mask mandates work to raise compliance. They are unenforceable. And that brings to the point that everybody's making about freedom of choice. Well, it is unenforceable, but it does increase compliance and it does increase community safety. The choice for many of us who believe in masks and believe in protecting ourselves and protecting our neighbors is removed when the businesses that do not require masks for themselves or their employees leave their businesses and go out into the community. And they've been exposed all day long to, you know, scores of people, hopefully, if they're doing well. And, you know, without masking and without protection, they're more likely to spread this amongst the community. Thank you.
Thank you, Ms. Dyack. Amy, is there, I think there's a couple more.
Joel had his hand up.
Joel who?
Joel Nolan had his hand up. He took it down, but he had it up.
Mr. Nolan, are you interested in speaking?
Hi there. No, sorry, I just clapped.
Okay. From here, I can't tell
Thank
the
you.
difference. Is there anyone else here, sir?
Hi, Robert Mancuso. I'm fully vaccinated on advice of my doctors. I'm not wearing a mask tonight. I think it should be a choice, so long as you have any kind of exceptions for not wearing masks. Like if I go to Loman's or the hotel for dinner, I walk in, I take the mask off, I'm there for hours, people walking in and out. So long as you have exceptions to wearing a mask, you shouldn't have any. But the bottom line is, who will enforce this? And what kind of fines? And if somebody takes us to court, how much is the town going to have to pay in legal fees? You know, it's coming down to personal choice. If you want to wear a mask and stay away from people, it's fine. Other than that, it should be up to us. Thank you.
Thank you, Mr. Mancuso. Yes, ma'am.
Holly Montgomery, and I live here in Chester. I would encourage the Select Board to craft something that would be really helpful for businesses and the public to know that, yes, you do believe that masks help and you want to work toward the health of the community. And I feel your leadership is so important so that if I were a business owner, could say, well, yeah, my Select Board says that I can put a sign on my door, you must wear a mask to enter this establishment, and I'll be covered. You know, people can complain, but I can say, well, our town believes that wearing a mask is really helpful. And as someone who works in retail, we have a sign on our door that says you must wear a mask. And if someone comes and says, I say to them, you have to wear a mask, and they say, I'm not going to wear a mask. I said, sorry. It makes me feel protected inside the establishment if people have to wear a mask to come in. So I encourage you to craft something that will somehow bridge all of this. I trust you to do it. So don't be quiet. Say something. Be leaders.
Doesn't say.
Yeah.
Who's that? Was that Nick Boak?
Somebody else in here?
No. There-
Oh,
Mr.
Nick-
Surso?
Nick Boak.
I'll get him next.
Oh, okay.
Hi, Jerry Usey again. So I've listened to both sides, and I've been pretty vocal on social media about this topic in the town. I myself and a lot of others feel that if someone who owns a business feels comfortable with someone not wearing a mask or someone wearing a mask, that should 100% be up to them. And just like everyone else has touched on here, if the state experts who we've all been told since the beginning to listen to are saying that the state already has tools in place to combat COVID and that the numbers don't warrant mandating a mask, I'm not sure why this should trickle down to local government trying to make this decision. I believe that this town that I love, people will make the right decision without being forced to do so. Springfield's a perfect example of what we should do. They made a compromise. In town buildings, they're asking people to mask. They're putting out guidance and educating people on what masks will do and how it will help reduce risks, and giving each business the power to choose for themselves. Everyone is right. It shouldn't be someone worrying about someone else giving them COVID, just like when you drive down the road, you shouldn't have to worry about whether someone's speeding and gonna smash into you. But those are the risks we take every day. Until it makes sense across the board, I don't feel that we should be making it the business's problem to make it enforced for everyone to come in and shop in their buildings. In addition, it's gonna dump gas on a fire that's already raging. You're gonna have people fighting amongst each other's, self-policing, and I'm sure the police department has better things to do and their hands full at this time than getting 200 calls a week for no masking. It's pretty simple. Leave it up to the businesses. If you're not comfortable, you don't have to go in there. Thank you.
Thank you, Jerry. Mr. Goodfellow?
Thank you, Arnie. I have listened very carefully, and I think it's a good point that if we, as citizens or residents of Chester, have to go into a particular building, like the post office or like town hall or buildings where we have to conduct business and we're required to go in, then absolutely there ought to be a requirement that you have to wear a mask. I can see that if I look in the window of a restaurant and I see people there not wearing masks, I see waiters not wearing masks, I see people pouring coffee not wearing masks, I'm not going to go into that establishment. I want you to know that over Thanksgiving weekend, we went to visit relatives in Manhattan. In Manhattan, every restaurant, every museum, every Broadway theater, every place requires a proof of vaccination. We had to show our vaccination cards. In New York, there's an app where you can upload your information, and everyone had to show their app on the phone to get into any building at all. And today, Manhattan mandates masks unless the business also requires proof of vaccination. So they work. Masks are an important weapon in this battle. It's not a perfect weapon, but it does work. And I think we should do whatever we can to try to fight this disease as effectively as we can. If it is so important that people have the choice not to wear a mask in particular businesses, then so be it. There are many of us who won't frequent those businesses anymore. But I think for a minimum, any building that is owned by the town of Chester or the federal government or the state government, or where people are required to go to get their business accomplished, they ought to be required to wear a mask. Just a point of reference also, the infection rate for COVID in Manhattan today is about 1%, 1.1, 1.2%. The infection rate in Vermont is over 4%. In Windsor County, it's surging, and in Chester, I'm not sure exactly what it is, but I think it's well over 4%. So those are the facts, and I just hope you make the right decision, and we trust in your management. Thank you.
Thank you, Mr. Goodfellow. Anybody else online, Amy?
Not at the moment, no.
Is there anybody else here in the audience that would still like to speak?
Arnie, can I add my name to the list? It's Marilyn Mahusky on Zoom.
Marilyn.
Hang in a second, Marilyn.
Yeah, well, I just wanted to make sure, I was out here. Thanks.
Sarah Yake from Andover, and I've been a owner of Salon 2000 since 1992. We have been cleaning our salon between clients, wearing masks, following the governor's mandate since last year, for the last year and a half. I feel like we've learned a lot, and we're smart people who want to stay in business. We don't need to be told to have to put a sign on the door. We respect every person that sits in our chair, that if they're more comfortable with us masking up, that's what we're going to do. If I feel uncomfortable with who's sitting in my chair, I'm going to put a mask on. But again, that's my choice. And we know how to clean. We know how to be extra careful. We don't want to jeopardize what we're doing any more than going into somebody else's business, but we don't need to be told. Thank you.
Thank you. Ms. Mahusky, are you out there?
I am, yeah. Thanks,
Go ahead.
Arnie. Thank you. I am joining a little bit late, so I haven't had the benefit of hearing everyone's comments that preceded me, but I've heard the last few. I see this as a public health issue. I think that when the governor had ordered folks to wear masks a year ago, prior to the benefit of being able to have a vaccination, we reduced the spread of COVID in this state, and we were leading the nation in the numbers of COVID infections. I think that wearing a mask, I respect that people have a different point of view than I do, but I would say that if there are local businesses that are not complying with a mask mandate, then I would be less likely to visit those businesses, that I would take my business where I feel like there's a respect for public health. I heard on the radio yesterday morning that over 800,000 people in the nation have died of COVID. I also heard, and this made a really striking point with me, that every single one of those people have friends and family who were affected by that death. I'm one of those people who was affected by the death of someone who died of COVID. I lost my twin brother to COVID this year on August 9th. He was not vaccinated and he didn't wear a mask. I will experience that loss for the rest of my life. It's a horrible pain to watch someone die of COVID. They cannot catch their breath. So I don't see this as a choice issue. I see this as a public health issue, and I would encourage the town to view it in that vein and encourage people to wear masks by having a mask mandate. There are many things that the town, and I'm not suggesting we do it and not enforce it. On the other hand, I don't think the issue is enforcement. I think the issue is let's work together as a community to protect the members of our community who we care about, whether we share a same point of view or not. Thank you.
Thank you, Ms. Mahusky. Is there anyone else that would like to offer their comments to the board? Anybody else outside? Amy?
No.
Well, we've heard a lot of comments.
Jerry, did you want to say something, Jerry? No. Oh,
I guess,
sorry, Arnie. He had raised his hand.
It seems like we're on this fence of safety and freedom, right? You know, and it's this divisive issue, and it's a decision that everybody seems to be having an idea about, but it's just about a way of moving forward. And like I said, I mean, you can find statistics everywhere you go. You know, there's whatever side of the aisle you're on. It's just a matter of knowing that we all have different perspectives because of our upbringings and what news we look at and where we get things. And so I think at the end of the day, if we can respect each other, you know, as a neighbor and respect our personal decisions, I think that's all that we can ask for. And that's really it at the end of the day, I think. But that's all I wanted to say.
Thank you, Mr. Kelly. Yes, ma'am.
My name is Sharon Baker, and I own 2 businesses on the green. Sharon's on the Common. I've been there for almost 12 years now, and I opened a candy shop this last spring. All I would like to say is I have people walking in my door, especially the big shop, every single day with a face mask on, and they peek around the door, and they say, "Do I have to wear this in here?" And I tell everybody, please do what works for you. I am not going to enforce anything or make anybody feel uncomfortable. 70 to 80% of the people who walk in my door wear a face mask, and they wear it the whole time they're there. I'm at least 6 or 8 feet behind the counter most of the time, and it's a very amiable situation. I am not going to feel comfortable telling people you can't come in my shop if you don't have a face mask on, because it's not my place to tell them how to live their lives. Thank you.
Thank you, Ms. Baker. Anyone else? Any other comments? No one out there, Amy? No more hands up?
No.
Okay. Well, we've heard
25.
a lot of 25.
Yeah.
25 people have spoken to this issue.
Actually, I have 20.
It's quite a division
You have
on it.
28? Okay, I may have missed.
28. We have, as a board, have to make a decision on where we're going to go with this, on whether we are going to pursue a mask mandate, whether it's going to be something less, some recommendation, or whether it's nothing. And I would welcome at this time comments or concerns or questions or statements from any of the board members regarding this issue.
I'll make a comment. I want to be clear where I stand. I will not vote for a mask mandate, nor will I vote for even putting a rule in place. They're both totally unenforceable, and it also takes on liabilities for the town. I think it comes down to choice, and it's impinging on people's civil liberties. And it's like the business owners, they have the right, if they want people to wear masks, they can put a sign on their door and ask them to wear a mask. And I'll respect that. I'll either put on a mask or I won't go in. That's my choice. And if you do put on your door that you don't want people in there without masks, that's the only time it's enforceable, because you can ask them to leave, and if they don't, you can call the police and they can be removed for trespassing, and that's the only time law enforcement can get involved in it. I too have lost a family member to COVID, and it wasn't my cousin. He was down from South Carolina. He spent 12 years in the Air Force, came out, had lung cancer. They removed part of his lung. He knew what his risks were, but it was his choice. he knew exactly what he was doing. And also, everybody, these masks, you get these in the store. You think these are the blue ones that everybody wears, the disposable ones? It says right on the box, to filter out dust, particulates, and smoke and pollen. And on the back it says, this mask does not remove the risk of contracting any disease or infection. It says right on the boxes. This one's more like an N95. It's a little more stringent. And on the back here it says it has a caution for patients with severe respiratory diseases, COPD, cardiovascular diseases, and pregnant women should use this mask with caution. Well, anybody knows this reduces your oxygen intake. That's why those people are cautioned not to use them. And as a side note, the interesting thing is, all these masks are made in China. So, and there was another warning on another box, and I couldn't find it to bring it, but it said, this mask will not, warning, this mask will not protect you from viruses or infections. Now, I don't see us getting involved in any kind of mandate or rules that obviously there's no guarantee of protection or anything. And I can say that I respect everybody's opinions, but one thing that I'm not happy about is I've lived here all my life, and somebody saying that we don't care because we're not making a mask mandate, that's downright disrespectful in my book, because if none of us here would be sitting up here if we didn't care about this community. We have to take a lot of heat, we take a lot of grief. We all don't see eye to eye on things. We have differing opinions, but we work together, and we try to do the best for our community. We're up here because we care, and we're doing the best we can. But I'm telling you right now, I will not vote for a mandate or a rule. That's all I have to say.
Arnie, I'd like to put in my 2 cents as well, if I could.
Go ahead, Luke.
The issue for me boils down to what our jurisdiction is. What can we require as the leaders of the town? And I don't feel that we can require businesses to do something. We shouldn't be in the business of telling them how to run their business. And so if a business owner wants to put in a mask requirement, they can. If they don't want to, they can do that as well. If they don't want people to come in that don't have masks, that's totally up to them. I don't think we have the authority to put into place a mask mandate telling somebody who runs a business in our town how they should run their business. And so science beside, there's a lot of controversy about the science. There's a lot of information out there that goes to one side or the other. I don't think that's the issue. The issue is, can we, as the town leaders, impose something on the town that the state's not even willing to do? So from my perspective, I would be against any kind of mask mandate because, again, I don't think that we have the jurisdiction to require businesses to operate their business in a certain way.
Thank you, Lee.
Thank you.
May I speak? Thank you. I was really glad that so many people did come out and show an interest in this issue. I also would like us to think about, as a board, what Springfield has done. And I wasn't prepared to bring information about that tonight, but this is a resolution, and I think what it does is answer a lot of the questions that the business owners have in the respect of how they will respond to people coming into their business with or without a mask. So it's not a mandate, but it's the resolution they came up with. And I would, because we did hear lots of conversation tonight, which I value highly, I would like to think about perhaps looking at this a little more closely and coming back perhaps at our next meeting with, or have a warned a special session, or not special session, what do you call it?
It would be a special
Executive se-
meeting.
Special
If it
meeting.
was not on the scheduled times, it would be a special meeting.
Right. I
So-
mean, I'm still absorbing the good words I heard, the information I took in, and, you know, I don't want to jump yet. I have thoughts of it myself, thoughts of what I'd like to see. That's just what I needed to say.
So I just have a question. Somebody mentioned Springfield and the decision that they came to where they're requiring masks in public buildings.
In the town building.
In their own town.
In their
Okay,
town
yeah, because
buildings.
we can't mandate state or federal building.
It would be just
Correct.
on
So
our,
just
in
be
our
the town
property.
building.
That's
on the
right.
town's
Just want to
property.
make that,
Right.
ask that for
That's right.
clarification. Thank you.
And I think their mandated, not mandate, their recommendation is worded as more like a suggestion than it is a mandate. And there's no enforcement that goes with it and stuff, but they stated some of the ideas that they wish people would follow. Like, we recommend these things. We can mandate this, and there are legal avenues to enforce it. That's a whole nother can of worms. That's a whole nother process involving police and fines and civil authorities and everything else. And
So Arnie, I'm sorry to interrupt, can I just ask a question? So it sounds to me like you're saying that we have the authority to require this?
Yes.
I know that there have been other mandates that have been implemented and have been thrown out as unconstitutional in the U.S. So I'm just wondering where we are getting our information about the ability to do it. Maybe we can, maybe the state gives us the authority, but I'm just wondering
And the governor did.
yeah,
whether
the
we
governor
ought
had
to.
we're a Dillon state where the only authority we have is what's given to us by the state government.
Okay.
And he brought the legislative session back, back into session as basically a compromise, because he didn't want to do this mandate, but he wanted to give the towns the authority to do this. And in the bill that was passed, we do have the authority to do it.
Okay.
You could do it civilly, you could do it criminally. There is a sunset on it, I think it's 45 days,
It's
and then it
April,
can go
the end
for
of
another
April.
30 days or something like that. It just gives the town the authority if they want to do this. It's not a requirement, and it's not something that we have to do. It was a tool that was offered to the towns if they want to take this action.
I would just like to point out,
I'd like,
I'm sorry.
yeah, thank you, hi. So I want to say I respect everyone's time and energy and perspective for coming on Zoom and here to let us know. I sense a lot of frustration. I too am very frustrated with this long-term pandemic. So I'm respectful of all of our opinions. I come from this as a nurse and someone who has a master's in community health. So in this seat as a politician, I understand that we have to, we want to listen to you. We want to make the right decision. But my basic, early on education is as a nurse and a master's in community health. So I feel it's a public safety issue. I believe there's an arsenal of things that we can use in medicine, and one of them is a mask. And we now have a vaccine. That's good, although, and by the way, this is emotional for me. I think there's been a great deal of suffering for us individually, for us physically, for our country, the world. I mean, Italy closed. You knew something was going on when Italy closed, and it's been a hell of a ride for all of us in economics. And I'm a small business owner, and I respect where you're coming from. I do think that government serves a purpose in this role. I call Jeff as the fire warden when I want to do my burn pile, because if it's dry, he's going to say, you can't do it, Heather. But if it's wet, it's been raining, snow, blah, 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 I can do that. The tornadoes recently the 272-mile-long tornado, we have government that steps in to tell people there's a warning. So my problem is, we have these businesses and we go, it's your choice, it's your choice. And I believe in free choice. I believe that people should be able to make decisions for their families, for themselves. I do. I have to tell you, I think government needs to have some way of letting people know. Our rates, I heard the other day, 10% of the population in Chester is positive. I don't know. I'm not an epidemiologist. I wish the governor who has the epidemiology at his disposal took more action. So I think he abdicated his responsibility, and now we're here, right? And I don't like where we are. But I think we need to send up a flag to people over the holiday. I don't agree with you, Lee, that we can kick this down the road 2 weeks. We need a way of telling people COVID is prevalent in our community and it's high. Because the risks that you have and the decisions that you're making should be made with the best information you have. And so, at the very least, I would recommend that we have a recommendation, and I think we're in this for the long haul. I don't think it's going away in the States. The variances are coming, and I think we're going to need to, like, we tell people respiratory, the air quality of our air. We tell people about weather. These are ways that the government tells people, you know, there's a storm coming, you may not want to go down the freeway. These kinds of things. I think as the government, we should be able to tell people our prevalence is really high now. That gives people the information to wear the damn mask. So I would recommend that we have a recommendation. I don't think a mandate's going to pass, but a recommendation that we put signs up that say we recommend a mask because our prevalence is high right now.
Yeah,
I think we need to do something to let people know, then make the decision themselves.
Yep.
And government has that right. We have that power. And so the nurse in me, the public health person in me, and then the government person in me, I want people to know. And that's how I feel. And I think we need to honor the amount of suffering that each and every one of us in different ways have experienced over the last year and a half. And I don't think our suffering's over. So that's all I have to say.
Thank you, Heather.
That was very well, nicely put, Heather.
Very well.
Thank you.
And I think we all agree with the statements that you made. And I have a hard time sometimes with some of the discussions that I've heard about anti-maskers and anti-mask mandate. There's a big difference.
Right.
I'm not anti-mask. I'm anti the government telling me to wear the mask in issues.
And this is the time of year that we especially celebrate most religions celebrate our fellow man. And I'd like to just have us come together more as a community and let people know our prevalence is really high. I think the mask mandate, that's what people see. We're going down the road and we have that little flashing light. You're going too fast. It happens to me occasionally. Don't come looking for me. But then I go, okay, and then I'm back to thank you. You know, we need some flashing light to let people, visitors in town, and, you know, as a nurse, we talk about underlying conditions. And, you know I have a few underlying conditions. All of you do. You just may not know it. And so, you know, we all have vulnerabilities as humans. As we age, we have more. But I think we need to let people know.
So Heather, I'm a little bit confused about what your recommendation would look like.
My recommendation would look like the Chester, the governor and the legislative session kind of left it up to us. So I think they've abdicated their responsibility, and I feel in the seat, I have the responsibility to let our community know our prevalence is high. So I would say
How would you do that?
that Michael had a suggestion of having signs on every door that the select board recommends that you wear a mask, our prevalence is high. Business owners can say, come on in, we aren't, but at least it's something to let people be aware.
So, a couple of questions.
And I would do it for a month.
So who's going to pay for it, and who's going to enforce it?
Well,
I don't think there's an enforcement thing. I think it's more.
But I'm sorry, just let me follow this up. So we're going to make a recommendation, everybody puts a sign in their window.
No, and it's up to the business owners if they want to put that sign up
Okay,
on their window to reinforce whatever policy they might have.
Okay, that's
If we
what I
come
wanted
out
to
with
hear.
a statement or a resolution or whatever stating something along the lines that Heather said, you want to use it, fine. It'll give you a little backup for your business or whatever if you want to put it there. If you don't have to.
So what's to prevent business owners from doing that, even if we don't do anything? I mean, there was a suggestion I saw from somebody in the CEDC that said, I think we should have unified signs that everybody can put in their businesses. I mean, we're not stopping anybody from doing that. If somebody wants to crank out a bunch of those signs and hand them out to all the business
But
owners.
I think if we recommended, if we said for the next month, our prevalence is high in Chester, we're recommending masks. I think that is something that the business owners can put it on there and be respectful of other people who may not know that the prevalence is really high.
Yeah, I think a statement like that carries weight if it has the approval of the board. It's a statement from town government.
Right.
It's not required, it's not, you have to do this.
Right.
Here's a recommendation, here's how we feel, here's what we think. So whether you use this tool or not, that is up to the individual.
I'm trying to think of the impact this would have on the small business owner who, somebody comes into town, and I'm not sure where the first sign would be that they would see. Some shop, I'm guessing, we wouldn't have them posted on town highways or anything. Would it be on the website? Because, somebody looks at it and says, oh, I shouldn't go to Chester because the prevalence is high. So they skip the small business owner who's struggling to make ends meet because, whatever.
The wording of-
I'm just curious as to how that would directly impact the small business owner.
Well, the wording of it could be something different than the prevalence is high. I mean, there's a way to make it, I think, to make it serious and to make it clear on our position without scaring people. And the thing is, if it is high, we're just being honest.
Well, and if we prevent one person's death or profound suffering, I think we would all want to do that. I don't think there's anyone in this room or on Zoom or even in the lovely town that we live in wants harm to another individual. And this is just preventing people from suffering more with this horrific pandemic.
And it's reminding people that
Yes.
this is where we are.
Yes.
I mean, it's out there. It's
Where are we getting
letters.
this information that the prevalence is high? Because in the last 2 years, this information has been all over the place. So where are we getting that
You can go
information?
to Vermont.
Number one, and the gentleman on there said he went to New York City and said their transmission rate was down to 1%. In Vermont, it's 4%. Well, we're a community of 3,300 people, not 8.5 million. So how does that figure in there?
Vermont.gov, you could go and they can show you on a daily or every other day basis where the numbers are by town, by county, throughout the whole state. Schools, also, they keep track of.
But they're counting infections, and I haven't heard many deaths lately. We're still getting infected, but
there are deaths. There are deaths.
it's not like it was.
I don't know.
Thank God. But that was before we had vaccinations.
Right.
Boosters.
I don't know that we should be chasing the science end of things. I mean, I think there is an impact, but I think the question comes down to how do we as a board address the question that's before us, and that is, do we implement a mask mandate or something else? You know, regardless of how we feel about why we should do that or not do that, I think that's the question that's before us. I mean, we spent all afternoon or the rest of the evening talking about the science and, you know, your interpretation of it or mine. But I think the issue is, what are we going to do about the suggestion that has been made that we mandate mask usage in town? That's my question.
The question you're saying is, do we mandate masks?
That's the question. It has been suggested to us that Chester implement a mask mandate. That's why we're here discussing this particular issue. So either we issue a mask mandate or not, or something in between.
Or
so
we
your
make a
suggestion is
recommendation.
A recommendation, which is not a mandate.
To be reevaluated in a month,
Yeah.
or the second meeting in January.
I'm still,
every meeting for that matter as we go along.
Yeah.
I'm still having a little bit of an issue with that, just because we're requiring something of a business or strongly recommending something. It goes against what I think personal responsibility is all about. I understand where you're coming from, and I just am taking a little bit of a different approach.
Well, and we all have, and there aren't two ways of looking at this. There's hundreds, right?
Well, we have
But
28 so
think-
far.
Pardon me?
28 so far tonight.
Well, but, you know, we have a town of 3,000, whatever, so we have probably 3,000 different opinions. So what could we do to make people safe in our community and yet respect other people's perspective that's a little different than mine?
You know, the issue has always been framed as two sides, us or them. It's not that straightforward, it's not that
think
simple,
we're all in
it's
this
not that
mess
easy
together,
to put it
but-
like that. And when we do that, we divide everything.
And-
It gets divisive, it gets ugly, and it's two different camps. I mean, that's
It's
not
not
who
fair,
that's
yeah.
not who we are. That's not how our town is. We're a lot more diverse than two issues that pop up. In this case, they're serious, they're scary. I don't think this is going to go away. I don't think it's going to go away with a mandate. I don't think it's going to go away with anything. And a lot of it is, I think, you know, and I could start ranting and raving about our medical system, about how it's money-bound, how the pharmaceuticals are making buku millions of billions of dollars profit at the suffering of the people of the world and not sharing their intellectual property with the rest of the world. This thing ain't going away even if everybody in this country was vaccinated. Some other variant's going to roll in here and we're going to go through this again next month or something. It scares the hell out of me sometimes.
So again, my
I don't know what
question
to
is,
do.
what are we doing here tonight?
Well, do you want me to make a motion?
Well, I don't know.
Do you want me to make a motion?
I guess the question, are we
I
done
make-
discussing it?
I'll make a motion that the select board
Somebody
makes
had
a.
their hand up.
No,
Did you
we're going to
ready
hold
to-
off
Well,
on public comments
Okay,
for this minute.
I make a motion, right? A motion that the select board makes a recommendation that suggests that we highly suggest mask wearing indoors and
In public spaces.
in public spaces. That's my motion.
And in the town spaces, town
So
offices.
Heather, what was that?
In
Town.
public, I said.
Okay,
So that-
yeah, okay. Yeah.
What was that motion again?
Yeah, make it again, Heather, I want to interrupt you.
Okay. I'll make a motion that the select board recommends mask wearing in public places until January, what's the second meeting in January, Julie?
The first is a Friday, Saturday.
Sorry.
It'll be the 8th. 7th and 8th.
19th.
Until January 19th to be reevaluated at that time.
Heather, is that motion? Is there a second on the motion?
I'll second the motion.
Lee is a second. Now, further discussion on this motion.
So the motion to me sounds very unclear, and I don't know if you want to restate it, but basically, you said that mask wearing in public places, so would that mean?
Indoor public places.
Okay, indoor
Indoor
public
public
places,
Thank
that's
you.
the clarification.
And help me out more.
Yeah,
Is there
that's the
something else you'd
clarification.
like?
Well, again, I'm not sure what this would actually look like. Is it a poster, a sign? Does it go on the town website? How would we work this out.
I think we could put it on the website, and I think we could do a poster that businesses could print out and put in their window. And I could probably do the poster if you wanted me to. Not that my skills are that great, it won't look pretty.
I would never.
But we could get that done. And then there's no charge. There's a printing charge if people are putting it up.
If we had the time, and I know at this point, I don't want to wait 2 weeks to do anything like this.
No.
But I wouldn't mind a little research for a day or two, just to word something that was crafted a little more formal with our approval on it, and maybe come back.
Are you saying I'm not eloquent?
I agree with Ari. I think it's too unclear for us. I can't vote for the resolution or whatever the motion is because it's too unclear to me, the ramifications and what it actually would be.
Why don't we try to craft something in the next day or two and come back for a special meeting on Friday or Monday or whatever we think it would take to do something like that.
Yeah.
Table it for now until the next meeting.
No, that's too far out.
Oh, no, not next meeting, a special meeting.
Oh,
With just this item on the agenda.
Yep.
I mean, that's an idea, or we could stay with the motion as she stated and have a vote on that. What's the preference of the board?
I'll call for a vote.
What is it going to sound like? What are we voting on?
On Heather's motion.
Heather's motion, okay. Which I seconded.
Well, it's up. I mean, we have a motion and a second, and we're having a discussion on it, and I will call for a vote in a minute.
And what we can say is within the next 2 days, did you want to see the poster? Or do
I want to see more details of what this is going to look like. So not necessarily the poster, but that'd be great to see what the wording is. And also to see how it would get disseminated. I guess that's 2 things that I'd like to see.
If we're still in discussion, I'll just say that I totally respect what Heather's trying to say and trying to do. But at this point, I'm a nay, because we've had 2 years. Everybody has had this information. Everybody knows. And I'm just afraid, like Lee is, that this is going to be adversely affecting our businesses.
But everyone doesn't know.
That's right.
And we were the best managed state with COVID. And now we're vaccinated X amount and we're seeing surges. So how are we going to communicate to people in our community and people visiting our community that our rates are up? So that how are we going to tell people that?
Vermont.gov. I mean, Lee Dakin said, you go to Vermont.gov and you can see what the rates are, et cetera. I mean, I guess from my perspective, I'm seeing us putting extra work out there to do this when
prevent suffering.
When the information is readily available.
Well, I think we should be more proactive.
All the information is readily available, but it seems like this is more of a personal statement from the board, specific to this town, specific to us 5.
Yeah, and I'm not against that. I just want to see details, that's all. I don't think, like Jeff, I don't think I could vote in favor of this motion at this point because I don't think there's enough information. Now, if Heather said, well, I'll withdraw and we'll table it and then make a recommendation that we meet in a few days with some specifics, I'm happy to do that.
Today's Wednesday.
We could postpone this to a time specific.
Yeah, I'd be willing to do that in the next couple days if we could agree.
What day and time would work? Friday?
Thursday or Friday would work with me.
Friday.
I don't know. Julie, you'd be involved with this
Yeah,
too.
not Thursday.
Not Thursday.
That's tomorrow.
I can't do
I know.
Thursday.
No, that's true.
That's tomorrow.
Friday
I
at
can't.
5 p.m.
I can't do tomorrow. Friday
Friday.
at 5, Friday at 5 or 6 would be better for me.
6? Can we do
Friday
Friday
at
at 6?
So we could table this till Friday, a time specific at 6 o'clock.
And I'll work on my motion wording.
Well, and the wording that goes with it.
Right. Good.
So Friday at
haven't
6.
voted for it.
Here?
Here's
Same.
fine.
Yep.
There were a couple of hands up, and at this point, I would welcome if someone had a comment that they wanted to make regarding this discussion. If it's brief, to please come up to the microphone and.
Sure, I can be brief. Burley Sunflower, Erskine's. Again, just as a member of the business community, the recommendation piece, which wasn't part of the discussion before, actually is okay, right? Like, that's something I can get on board with. I don't want to have to enforce a mandate. That's not my role as a business member. I would love to put a sign up that says, the Chester community recommends that you wear a mask because of X, Y, Z. Great.
Good. Thank you.
Thank you.
I actually like that wording better.
Oh, well, write it down.
Well, we haven't done the wording yet.
Say that again. All right, a couple of things. A huge thing that's been talked about is division. Doing this is going to say, if I don't agree with what your recommendation is and I don't want to put it up, it's going to divide me from the other businesses that you're putting that up. If they have their personal preference to put up a sign that recommends it, that's completely different than the town supporting it. And so from my perspective, if you guys are recommending for me as a business owner to put it up on my window and my neighbor puts it up and I don't, you guys are telling the customers that are coming into their business and then coming to mine that we're different.
Scott, we're not recommending anything for what your business can do or not do. Those
No,
are,
but you're
those
right.
are kind of like your words that you said.
That's
But
right.
if we
But
make a
it's-
resolution because of something that we feel strongly about.
Right, but
you
it's
can
our
agree
option
or
to
disagree with it.
Right, but you're suggesting that it's an option for us to put it up or not. That's what you're asking us to do as business
I'm not
owners,
asking
right?
you for anything.
Okay, so.
That is an
It'll be
option that is
available to you
It's gonna be
if you
available.
wish.
Whether you want to
Yeah.
or not.
Okay, so, but what my statement is that what that's doing in my eyes is that is setting a line of division between the people that want to print that off and are saying, well, I'm taking the support of my select board and the next door neighbor is not.
That's why I said I liked his wording, because
Yeah.
he said the Chester community.
Right, yes. So,
Well, no, it's the town.
I don't think
it's
the
the
select
town
board
government.
can say the
That's
Chester
right.
community
We can make,
because,
we can put it on our.
that's
Because
just my
it's
input, that's all. That's my personal
No,
feeling.
Yeah.
Okay.
Thank you. Mr. Blair? Is it okay from,
Chester member.
yeah, you're from Andover. We'll still let you speak, I guess.
What Jeff said about, actually just sitting back, listening to all the business owners say that they wanted the select board to back them if they said no, coming in without a mask on. I think a sign up saying that you guys would support that end of it if they decided not to, or decided to have a mandate in their business.
well, and then we're talking about legalities
Right,
of,
exactly.
of
No
someone
mandate.
catches
It's more
COVID
of
and
just-
we've
it's
said
more
you
of
don't
just
have to have a
Saying
mask.
that the police will support that is what I'm saying. He just said that. He said that if you decide that in your business that you can't come in without a mask, it's trespassing, right?
I mean, whether this
I didn't
COVID was
say that.
happening or not, that's the only way
It's
that law enforcement can enforce it.
saying.
If a property owner, it doesn't matter if it's a business, doesn't want somebody there, and they ask them to leave, and they don't leave, that's trespassing, and then they can call law enforcement.
A lot of people don't know that is what I'm saying, from
Okay.
sitting back and listening to all these conversations.
Well, it is, they can be
It is not an
confusing,
easy decision here, and
No.
we're not in an easy place.
and we're not trying to do the enforcement piece. We're trying to do something where we can be with the community, with the business, with the people who live here, and try to help us all stay safer and better. Now, if I hand out one of the posters or whatever this size
Flyer.
person flyer that and the business owner chooses not to put it in his window or her window, that's fine, but it's there for them. It's something that we support as a town government body and would hope that it would work for all of us.
So we're going to leave this till Friday. Last one, Mr. Smith.
This is Garrison Smith, still own Smitty's. I'm going to ask you to be careful with the wording of the sign. Listening to you guys talk a little bit, You talked about infection rates in Chester are prevalent. And then somebody threw out a 10% threshold. I honestly don't believe there are 300 people in Chester that currently test positive. I'm going to ask you to figure out, you've got a 10-day quarantine period. You threw out 6 weeks until mid-late January when the next meeting is. That's when we're going to have this sign up. The infection rates today are different than what they're going to be in 10 days, in 15 days, in 30 days. If you put up a sign, if you come up with a sign that says, stay out of Chester because our infection rates are really high, I promise you I'm not putting it up. If you come up with a sign that says, the town of Chester strongly recommends wearing of masks in our community, I'm 100% supportive.
Until, and by the way, January 19th.
A date, not a date, but I'm going to ask you to be very careful about that wording, because if your wording is infection rates are high, and we can have a slide, I can change the number every day. Today it's 8%, today it's 12, now it's 4. I don't think that's a good idea. And if you're careful with the wording, I'm 100% supportive. If it's a big red sign that says, please don't come to my town, I'm not going to be supportive. So it just.
Well, and this is a discussion, and I would never want that, but we do need, I think we have a responsibility to let visitors and people in our town know.
And I agree, and that is part of the Vermont.gov website. Do we want to put up a sign that says, don't come here? I want a sign that says, be safe. And just listening to the conversation, there is a road that you could go down that in part of that conversation was headed down of infection rates are high, therefore we want you to wear a mask. I'm not going to support it.
And I agree with
but
you.
a well-worded sign, I'm 100% supportive. So, and I'm happy to come back to the next meeting and listen to that debate. So, and offer my thoughts.
Thank you. Thank you.
You do have a hand up.
What's that?
You do have Mr. Goodfellow.
Mr. Goodfellow.
All right. Mr. Goodfellow.
Thank you, Ernie. I just wanted to make clear that 10% remark that I think one of the select board members made. The Chester Telegraph reporting Vermont statistics just a couple of days ago said that there were 367 residents of Chester who have had COVID. And since we have about 3,600 population, that's about 10% of the town has had COVID. It's not that they currently have COVID, it's that they had COVID. I think that's where the 10% number is coming from.
Thank you, Mr. Goodfellow. Anything else from just last one? No, come on, really.
We haven't heard from
You've been patient.
Roy Spalding, Cassets. Are they actually going to vote tonight on whether it's a mask mandate?
There is not going to be a mask mandate per se, no.
Okay, thank you.
We will be having our next meeting
on Friday at 6 o'clock to discuss
the wording,
recommendation.
the recommendations.
Okay.
Right.
No. Anything else from board members as far as the
I think
discussion?
we need to, I think we beat it to death right now, so table it until Friday.
Friday at 6 o'clock, time specific?
We maybe can all gather our thoughts a little better.
All right, then.
And I'd appreciate
Thank you, everyone,
helping
for
with wording
showing up
if you wanna
tonight.
You're not
Appreciate
staying
it.
for the budget discussion?
Yeah.
Guys, let's
Let
take
me guess, your butt's sore now, right?
recess.
We
Last.
used to have cushions on some of those benches.
Maybe excuse you. 2-minute recess.
Okay,
Thank you.
Like slam for 2 days.
That's fine.
Do I have to do, what spring food?
Everybody can come up with some
I don't know.
examples and we'll try to figure it out.
Was it something I said?
Does anyone have water?
I wish I did. I don't have.
In the
I have
fridge,
some
water.
water.
No, there's
Usually
zero.
There's no water in the fridge?
Oh.
There's what?
Goes against what we've been talking about with the spread of That's water.
Yeah. Well, it came in the same package.
All right, let's get this road on the show,
That was fun.
folks.
Okay, I'll hurry.
Geez, Andy, what'd you say? Everybody left. You left, Jeff. Everyone thought they could go home now.
Follow the pipe, where you take.
Okay.
We are on mic. It's still being recorded,
It is.
even though
That's
it's
good.
recess, so
That's right.
That's
be
good.
careful.
That's
Yeah,
fine.
I have a tendency to say bad things sometimes.
You have a shredder at the downstairs, do you have a shredder?
We do.
Where do you go?
Nothing else. Our town manager, she's willing to shred this for me. I don't have a shredder.
Is that one? Oh, okay. There was some interesting reading in one of those.
I just forwarded you everybody. I didn't want to be
Oh,
biased
man.
on who
That-
got what, so I
that-
forwarded it all.
That one, the one that brought up,
Yep, yeah, anyway, move on.
Are you okay, love? Did you get a bone in your wall?
I've been talking too much.
Shut up, Jeff.
Thank you, Julie.
next item on our agenda is the general fund budget review, Parks and Recreation, and the Public Works. I don't know,
So Public Works,
did Kirby stick it out, or? is
no,
it-
It's sleet and freezing rain. Kirby is out.
Oh, is it?
Yes. It's sleeting, he said.
Think it,
Text I got was, it's starting to sleet badly. I'm not going to make it.
all right, how
Sleeping.
about Jeff?
Well,
I mean,
then
no,
I'm taking
Parks and
you
Rec
home.
is,
And Matt,
Matt.
I'm not sure. Matt, are you on there? Yeah, there he is.
Yes, I'm on.
So you can start with Parks and Rec, because Matt is on. The S is Matt. You there,
How
Matt?
are you? I'm right here, yes.
Yes, speak. Okay.
Hang in there.
Can you hear me?
Yeah, hang on.
I'm just trying to get to
Okay.
the page that Parks and Rec is there.
I mean, that sounds like some TV show.
That was a good show.
What page?
Parks and Rec is actually 2 spots. It is on page 7. And then the facilities portion is on page 8. No, I'm sorry. The facilities portion is on page 9.
Page what?
9.
Page 7 is the start of
7 and
Parks and
9.
Rec. Yep, you got it.
Rex.
Not much changed, but Matt is here to,
Good.
So Matt, you want to give us an overview on your budget?
Sure, like Julie just said, not much has changed. One of the biggest things, if I can find it again, I think she said it's page 9, the tennis courts getting redone. I think we put in 16,000?
yep,
Yeah, I gotta find it again, sorry.
it's okay. It's under
Is
facilities.
it's page 9, right?
Yep.
What's it do? Get totally tore up and repaved, or?
No, it's actually just, they fill that crack in and they paint it. They repaint it 2 coats, all the lines, stuff like that.
New nets?
Are you going to include pickleball lines in it?
I am actually, I'm not sure if the company's gonna do it or we're gonna do it after it's done. I gotta still talk to them. But yes, we're gonna put pickleball down again.
I had
It was
people
pretty-
asking me,
Yep, yeah, it was,
including myself, sorry.
that's okay.
The question.
I'm having a hard time.
The question on the, hang on, Matt, this question on the skateboard park, not the skateboard, the tennis courts, is that
Yep.
16,000
Right,
could potentially get pulled out from the budget?
Right, yeah, that's what I was
That
gonna
is
say,
something
the-
ARPA funding would fund.
yeah, that's why I was kinda went there first to go, to review that, if it
Yeah.
could get taken out and put into that money.
Any other things on the budget, Matt, that you'd like to talk about, or?
No, everything else pretty, I mean, honestly, not much has changed from the last couple of years, so that's just one of the things that I wanted to review first, just because it could go into the ARPA money or stay in the budget, so, and I think Julie was gonna talk a little bit more about that with you guys or with me later.
So what was the final verdict on the skateboard park?
Well, I believe we got a 50-50 matching grant.
Oh, great.
Yeah, and again, the skate park is likely eligible for ARPA money as well, because it's an outdoor space. There's an argument we have to make about use of public space and blah, blah, blah. But a lot of towns are using it for those types of things, and it's getting the blessing, so.
Good.
Any questions from board members or concerns about the budget and the recreation and?
Well, I see that, the plumbing issues this past summer at the pool, that's been resolved?
Not 100%. We got it's kind of a sad story, actually. So the guy that usually does our work passed away, kind of unexpectedly. So we do have all the parts, just the maintenance part that hasn't been done yet. It's just one of the filters of the pool.
Okay.
But Arnie did come in last year and he kind of plugged what we needed to and did what we needed to do to get through the summer. Because there's four plastic filters in the pool house. And right now the pool's running on 3, but we do have we have the 4th one. It was ordered, paid for. It just never got put in.
So Matt, correct me if I'm wrong, but that piping from in the pit down there, from that point to the filters, to that big size piping, that's the area of trouble that's going to be redone?
We'd like it to, yes. That was one of our things we'd like to get done, yep.
All right. Because it is a mess down there, that's for sure.
Yep.
Right, you've been down there enough, you know.
Otherwise, we'll have to send Jeff down there all the time to.
Yeah, I've been in snorkeling.
Yeah, he's been down there too quite a bit, so.
It needs to be all gutted out and start fresh and put it in something kind of reasonable form.
Right.
For the purpose of maintenance and for the efficiency of the operation of everything that's there, because the way it is now is, it's just a disaster waiting to happen. And I think we've been pretty lucky over the years that nothing's gone worse than what has by losing just one part of it, 25% of it, I guess, or whatever, with that.
Right.
So.
Yeah, looking to get more like on-off valves, stuff like that.
Yeah,
If one thing goes wrong, we can shut it off and work on it while it's off.
Yeah. Anybody else have any questions or concerns regarding the budget? How's everything else been going, Matt?
It's going well. Obviously, fortunate to use the schools. I'd like to thank them this year. You know, last year we didn't get to use the schools for our winter seasons, but this year they let us in, so it's a good thing.
Good.
So we're going pretty strong right now. It's nice. It's good to see the kids.
Yeah.
Matt, you ever feel like getting out a couple of cans of spray paint and hitting that Cisco trailer?
It has crossed my mind. What color would you like
If you
it?
need a hand, let me know. I like painting graffiti on walls. Anything that at least get rid of the Cisco part.
Okay, we can do that.
It seems like a big advertisement for a company, and billboards aren't allowed in Vermont.
That's true. You're right about that.
Get artistic with it, that's okay.
Yeah, remind me in the spring, and I'll get out the spray gun.
Maybe we'll have a painting party. All right. If there's nothing else, Matt, we'll let you go. Anybody else have?
All right, I appreciate it.
Thank you, Matt. Thanks, Matt.
Have a good night.
You too.
You as well.
Bye.
Too late for that. So Kirby, we're going to give a pass.
Bedtime.
Because it's nasty outside.
Well, I can address his budget.
Yeah, go.
Hope my husband has dinner ready when I get home.
Well, and I can I'll bring you up to date on everything.
Yeah.
Actually. So highway we have figured out, so at this moment, we have, these numbers do not include the warrant that you just signed, and there will be 2 payrolls. So the payroll that was this week, and there is 1 more in the month of December. There is also, we have another 2.5 weeks of revenue. So things are still going to are going to fluctuate, and sometimes significantly. Right now, we have highway has a current year deficit of about 50,000, but an overall surplus, because it takes into consideration last year when you're figuring the highway surplus. So it has an overall surplus of 124. So that has definitely been helpful in that number. Their budget is going to see an increase, mostly because of their contribution to the bond plan in 2022. So you're going to see that their budget is up, these numbers don't reflect it, but their budget is up a fair amount, again, because of bond plan transfers. Hang on, I'm getting my notes.
The capital plan transfer.
The bond plan transfer, which is line 7401, is up from 155 to 219. And that's simply because of bonds that are now starting to become due in highway. And then the capital plan, same thing. Now that capital plan transfer, 7600, that 199.9 includes paying cash for $40,000 for one of the trucks.
One of the pickups.
One of the pickups, not financing one of them. We overall are looking at, and this includes highways, year deficit of 50,000. The town right now is looking at about $120,000 deficit. So 50 of that being highway, 70 would be the rest of the general fund. And again, cost overruns in the EMS building, which hit the general fund that were not anticipated, is the largest contributor to this. But I think at the end of the day, we've done quite well because we've also put security systems in all the buildings, which was unanticipated. Cost overruns in emergency services is into 6 figures. To end up in COVID year, the worst COVID year, with pricing at this deficit is when I talked to the auditors a little bit today, they were like, if you land on that, man, you were lucky. So I'm comfortable with it. If we, I had a conversation with them about, okay, so we're likely going to land on some level of a deficit. How do we handle that? You know, what should we do with it? We ran through some numbers, ran through fund balance stuff. If we, again, numbers are going to fluctuate because we're still dealing with revenue and expense coming in and out the last 2.5 weeks. But if we let that deficit fall into the fund balance, at the end of 2021, as of today, our fund balance would be about $340,000. So we would still have
That's with the deficit into it?
That's with the deficit coming out. Now, because now we're dealing...
There'd be 340 left.
Would be 340 left. So, I mean, one of the things that Josh and I talked a lot about is, you know, that's why you have a healthy fund balance. That's why you have that. Again, this is an unaudited number because 2021 has not been audited. That's another reason to not necessarily always raise taxes when there's a deficit or a surplus, you know. So I feel comfortable in, and again, we'll see where everything falls out when we're done at the end of the year, but of just letting that fall into that fund balance and be content there. One of the decisions, and I'm telling you this only, obviously you would not make any decisions tonight, but this is something for you to think about going forward. Right, so we know we're going to have cost overruns on the town garage in 2022. We know that. We discussed that when we signed the contract, right? Russell is pulling together where they feel we're going to land. Like as of right now, where would you guesstimate we'll land as far as a cost overrun on the highway? So we need to think about how we're going to handle that in 2022. So, you know.
What are those numbers? I mean, what was,
Well,
the original was $1 million?
The project would be about $1 million, but it puts a cost overrun of, originally, I think we talked about 140. But that also contained a contingency. So obviously, we're not, you know, I have signed no change orders. There have been none needed. So I think things are coming fairly well. I want them to do an assessment, you know, from this point forward, what are they anticipating? So I'll have that for your next meeting. But just some things to be thinking about how you have some options, you know, do we not pay cash for one of the pickups? If, you know, do you add that pickup to the capital plan? It's $12,500 for 4 years, first payments being in 2023. So do you add that to the capital plan? That frees up 40 to put towards the building. Right. Do you not budget it at all? And we'll deal with it when we know what the actual number is. Potentially, again, let that fall to the fund balance. I don't want to hit that fund balance too many times.
What number do we want to try to get that fund balance to? What was the goal of that?
About 500.
Yeah.
About 500.
I mean,
So that should help eliminate any need for a TAN note to get.
The fund balance is what helped us have to only borrow $200,000 and.
A CAN note, what's that?
Yeah.
Tax
C-A-N?
anticipation.
Yeah.
TAN.
TAN, oh, I know TAN, okay. I thought it said CAN.
But I think at the end of the day, it kind of comes down for you guys maybe to what is, there's not going to be, well, I guess we could, but we're going to dramatically cut services. I mean, I don't think we're trying to present a level balanced budget. In the current day, we're going to have some kind of an increase in taxes. Right now, it's about 50,000.
Just over a penny?
It's just over a penny. What is an acceptable number to the board? And I think, and that's not to answer at this moment, that's just to process and think about, you know, what is an acceptable amount? And I think that will guide how we handle this cost overrun in highway that we know is coming. If we're saying a penny is it, and you want to budget 100,000 for the town garage, then something needs to get cut. You know, I think it's just to be processing, so you guys can be thinking about that while we're waiting for the numbers.
You have a certain amount of money that it seems like the town needs. How do you want to raise it?
Exactly.
The other question I have is, where are we at on the gravel pit? Is that coming in to help us with on the other end here?
So the gravel pit, we should be able to start revealing what we have for material next year. They're poking around up there and seeing what we've got and what we have, you know, what do we actually have in the ground. I'm budgeting conservatively. Because we don't know. We're not in the ground yet. We don't know. We only have what test pits showed in a few locations. So we need to kind of see how that all flushes out.
They're going to be scraping the surface in the spring.
Exactly. And they've started that a little bit already. So, you know, I think for 2022, we had planned to budget conservatively. You can certainly choose to not. That's up to you. My plan was to budget conservatively for a couple of years until we're really in there and see what we've got for material.
When they scraped the surface, what was the reaction?
There were some places where they were finding some material. There were some places that they weren't. Kirby's not necessarily concerned about finding material. It's just where on there is the largest supply. And that's going to take that's going to take some time.
Yeah.
You know, so.
But there's material.
They're finding
Well, that's a huge one.
We don't know the quantity of material, but they are finding some.
When you start digging and there's gravel,
Yeah.
then okay.
Well, my comment has been, you need to
Better
find
than
enough
hard
material to pay for what we had to go through for the permit.
Exactly.
He assured me that we will find that.
Which brings me up to another point, but maybe this ain't the time to discuss it, about what it did take us to get there, and are we going to do anything about some of the glitches that came up that weren't our fault, that cost us money? So, well, whatever, that's a different topic.
Yep.
Okay.
But it is related to the budget because it's money.
It is. It is, yep.
So we'll know a little more at our next meeting.
Exactly. Each meeting now, you know, December 29th, we'll have a better idea. This warrant will be reflected.
And the final meeting before, we have to have the exact numbers for January?
January 5th.
Oh, 5th?
Yeah.
That's really early.
It is early because town meeting is early. Town meeting is February 28th.
Not March?
Why?
No, it's the way it falls. It's February 28th. Yeah.
It's always the first in March.
It's the way the things all work. The calendar that we have received from the state,
Really?
that town meeting is, yes.
So how do they say it's the first Tuesday in March? if
Yeah,
it's in
exactly.
February?
I don't set the dates. I just go by what the state emails us. I have no idea.
It's always the first Tuesday in March, right?
Exactly.
I guess not.
It's not just the first Tuesday, it's the first Tuesday that follows the something.
You know, January 5th, to have all of this down when we only know our numbers on January 1st is obscene.
Well, this is why
Close.
this is why I've been keeping this up to date after every
No, I
warrant.
know, but.
Yeah, not waiting till the end of the quarter.
Right.
I mean, those are good things
You
to
have
think about.
really been
The
doing
numbers
that.
are there, and it's going to be, do you raise a penny? Do you raise two? Do you level fund it and make the fund balance go down further? I mean,
Right.
What did we raise it last year?
I thought we raised it a couple of pennies.
No, last year, no. Remember last year we had the huge surplus.
Oh, okay.
So it went up like a couple $100. Oh, actually, it went down a couple $100.
No, but the whole thing, oh.
Yeah, last year was the big surplus. The year before, I think it was a couple cents.
Yeah.
Well, did you say it was, you thought, at the moment?
It's about 50. About 50,000.
Which is?
About a penny.
A penny.
About a penny.
I think 40, 45 is a penny.
That's pretty good after the last
Well,
year and a half. we've
And my
had.
concern
The way inflation's
about
going and everything else, I'm
Well,
worried
and the
about it
auditors
too. That
see-
it might not be enough by the
that
time
we,
we're done.
you know, I don't like it when we put in the budget a buffer so that it all looks good at the end for no reason.
Correct.
But in this atmosphere, when there's so much uncertainty,
Right.
so much uncertainty, I really feel uncomfortable not having a little bit of buffer because of what we can anticipate.
I can agree because
We agree?
we do quite often.
Toast.
What I'm saying
Toast
is,
your water bottles right now.
a lot of the materials like the pumps and stuff that I've
She
been
said
buying,
with surprise.
their increases have been 15 to 25%. So that's just the materials that we have to have and use, you know, so we should have,
So I don't want to go for a penny and then,
right.
Yeah.
I'd rather go 2 pennies and have some, I don't like putting a budget together that you know you're going to have a surplus. I
No,
like,
and one thing in my talking to the auditors today, I mean, their comment was, in today's time, unless you are going to significantly cut a service that you're offering or really take a dramatic hit to your budget, there's no way to level fund a budget this year in these times. I mean, just the cost of living and inflation is going to drive costs up.
So you make a good point that I wanted to raise, and that is that while it's probably a good idea to have some surplus built into the budget, the problem is that most people who are paying the taxes don't have that surplus built into their budget. So my concern is that we be as frugal as possible, especially in the next year or two when things are so uncertain, because otherwise we look great and everybody else is griping because they don't.
Yep. And this budget, I will say, there were some hard conversations in my office with department heads this year. This is a needs-only budget. And I have been very clear, this is a needs-only budget for the next few years. I think Jeff can attest to those, to that conversation that's been had.
And that's great, and I appreciate you having those conversations because it makes our discussions with our constituents a little bit easier when we can defend the numbers.
Yeah. And the fact that we're only up 50,000 at this point, you know, kind of speaks to that. You know, everybody has really cut where they can and come in with their budget, send them back, no, let's try to do a little better. And, but I do appreciate that. But I'm also trying to not have it be, okay, culverts are $12,282. I don't want to do that either, because we've got to have some cushion.
Oh, yeah, yeah.
But, you know, one place that would give some cushion in highway is if I took that truck out and put it into the capital plan. I've also been sensitive about not doing that. I don't want to just take stuff out of the budget and dump it into the capital plan, because that's just paying it later.
How much more does that cost us?
Still there.
What was that?
How much more does that cost us when we finance it?
Well, right now, the rates, bank rates are like 2%. So 2% of 40 grand. It's not a ton.
Still, I mean, that's, the capital plan has its place, but I don't think loading it up with too much of
Correct.
the regular budget stuff.
Correct.
well, I think it's okay with things that we use over time. And so you pay over time if interest rates are low.
Especially the big ticket items.
Well, on the other hand, I can attest to, especially in the wastewater, it's been a rough year as far as things breaking. Things are just getting old, and fortunately, I've kept most of the pumps and stuff. I've had replacements, because, well, Julie can attest to that. I've had this issue with the volute for the main pump station. I still only have one pump running. And I had ordered one, and it took 5 months to get it, and it came in, it was the wrong direction. The company had ordered it the wrong way.
Turn it upside down.
Yeah, you can't, unfortunately, and that would be a great idea, but they didn't mill the top and the bottom the same.
That's what I figured.
And the other
Why
thing-
would that? That'd be too practical.
The other thing that is out there too, and as we start, like in 2022, really start talking about ARPA funding and really start delving into what's allowed, what's not allowed. There may be things in here. I mean, I really am inclined, if you agree, to pull that 16 out and put it into the ARPA slot. That's 16,000 out of the budget. But as we're starting to identify things that we can use, there may be things in this budget that we can say, oh, you know what? ARPA funding would cover that. Let's not spend it here, let's spend it here. And that's just going to happen as we make our way through 2022. And we're also, I mean, I'm slamming grants left and right, you know, as far as we're applying for everything that's rolling out. So some of these items may get grant funded also, which will obviously lessen what we spend and give a little bit more flexibility in the budget as well.
Fortunately, we're staying ahead of that too, because if you have the projects are ready,
right,
then it's
We're
easier to get
eligible.
the grant.
Is sidewalk starting next year?
Sidewalks will be starting next year. We should be clearing right away soon. Yeah. Yeah, Popple Dungeon will be done next year.
Speaking of which.
We do, I'm paying for that temporary bridge.
The new pavement is awesome.
Wonderful.
What country is that in? You can go really fast at it.
Especially my new car.
Maybe we should put a sign out there.
Speed limit's 40.
And then the capital plan is looking fine. We're not adding a whole lot to it this year. The real addition is the paving budget. Kirby and I went back and forth about doing Andover Road this year, but we will not be eligible for the 2-for-1 paving money this year. We would be eligible in 2023, would be the first year we would be eligible. So we're going to push that off.
It's going to be in rough shape for a year, but
It'll
It
slow
will be.
people down.
It will be, but when they pay 80% of the paving costs, we have to. So, at the same time that we do that project, we will also be replacing all the culverts under that road, because many of them are deteriorating. So, that we're going to push to 2023, where we can get some grant funding to help. So this year, it would be some minor paving, town garage being the big piece, and then adding into that bond the remainder of Popple Dungeon and the remainder of Route 35. And I felt comfortable adding those two pieces because they were originally funded through a bond. So I feel like it's kind of keeping in line. I don't want to typically add construction projects to the bond plan. I was trying to keep that paving only. But I think it makes sense, and it keeps that paving number really not any higher than we've been statistically going, so. And it gets a slightly lower interest rate.
so all in all, it's not looking too bad.
The capital plan's not looking too bad. We're just lobbing along 1 year at a time. 1 year at a time, one decision at a time.
Couple more to go.
Yeah,
We'll see daylight.
it'll start dropping off, yeah.
Any questions? Concerns on capital plan, bond plan, or public works?
Next meeting will be library, facilities, and that's it.
All right. Good. All set? Then move on to our cell tower lease. T-Mobile. In your package, you have the red line new lease, but had some changes on it from their attorney. And I guess it was corrections by ours, or they changed it more? How
Well,
does that work?
I was thoroughly annoyed, which doesn't take much to do these days.
I was going to say, that's unlike you, Julie.
Not lately, Lee, I can tell you.
Bye.
Okay, thank you.
The road? Is it still sleeting?
I don't know, but I've got the farthest distance to go, so I'm going to.
Yeah, you got a tough spot to where it's paved.
Yeah, safe travels.
So you guys, you signed it, I submitted it to them. A week and a half later, she comes back with, oh, thanks so much, I'll now send it to legal for review. I'm like, what? So Jim Carroll kind of did the same thing. What? So I did let her know, that's not really protocol. Typically, you alluded to me, because we went back and forth with changes.
Yeah.
Who was approving those changes?
Yeah.
If it wasn't your legal department. So, anyway, legal only came back with a few comments. I gave you Jim's email that had those few things. Jim's response to them in red. We've been through that. We filtered through that. The changes really are not substantial on our viewpoint, on our side and on Jim's side. They were minor. The biggest one was the ability to notification for relocating the tower. And we don't have any intent to relocate the tower within 2 terms. And so that's what we settled on, was the 2-term thing. So.
We should give them notice if we're going to move it.
And we do, and we do.
Yeah.
And we do. It was just this,
Why?
they wanted to be able to do some things without notifying us.
Oh.
And that's where we that's where there was a little bit of hustle back and forth, and that's all been resolved at this point.
So at this point, since we already signed it, do we sign it again?
We need to sign it again, because this one has some of those minor changes.
Okay.
But
And then
Jim's
something
good with all of them?
Jim is good with everything. This
Well,
is.
should I make a motion?
You can, and I will tell you what you are signing, their legal department has already signed, which is what is proper.
Just change a few things.
But anyway,
I can say that from this drawing and what's going on up there, I haven't been up there in a few years.
Yeah.
Man, it's getting awful busy up there.
yeah, it is.
There used to be one building in the tower and.
It's a whole community up there.
I'll make a motion for us to sign the T-Mobile lease agreement regarding the cell tower.
And your motion is to have Arnie sign it.
Oh, Arnie.
Second.
Now there's a motion, and Lee is the second. Any further discussion on this? All those in favor of the motion, please say aye.
Aye.
All set?
Okay, I'll pull it out, we'll do it after.
Future agenda items, new business.
Your next meeting will have budget and hopefully a Yosemite update. If not, that'll go into January, but.
Next regularly scheduled, well, it'll be a special meeting, won't it?
Fridays. It's-
Well-
There's just
Well,
that one issue.
I'm talking about the 29th.
Right, the 29th.
29th, yeah.
I know
Which is our third, yeah.
we were talking about the sidewalk project. Do we want to address some, the parking issues before we kind of set in stone where some of this stuff is going to go? 'Cause
What do you mean?
Yeah.
everybody's been asking about what we're going to do about parking on the green and
Oh, that
Oh, on
email
Main
came
Street.
today
throughout
about
town.
regarding Copley Street and stuff.
So
wasn't it?
I think just you and I got that. So on a future agenda will be, so the planning commission has met, apparently at their last meeting. There was some discussion and some recommendations about Copley Street parking that they would like to see you address. So that will certainly be on a future agenda. I was thinking mid-January when the budget is set and off the table. So parking will come up then.
All right,
But if you mean parking out here,
that's part of it too.
yeah, so that I anticipate, again, being part of the ARPA discussion, because I believe ARPA funding would pay for that.
Yeah, there was a whole idea about changing
Yes.
one of the streets and
Yes.
making more
Right,
parking.
yeah, over.
And it was,
Avon
I
Street.
thought it was a really good idea back when it was first presented, the way it was laid out and the way the parking was
Yeah.
there. And it changed the whole traffic pattern
Yeah,
and
make
kept
it
the front of it nice.
Avon Street, one-way street, which is
Yeah,
What's Avon Street?
Right here.
that little,
that 100 feet that's in
Yeah.
front of the Salon 2000,
In front or on the side of there?
in front.
That's Avon Street?
That's Avon
And I'm
Street.
driving
How
her home.
cute.
So you're leaving too?
So that would be on a future agenda.
Almost done.
No, I just had to get
No,
my.
I said Lee's leaving, and I
I
drove
can't, well,
her,
yeah, that's right.
so I better leave too.
I'm hurrying.
No, I'm just
No, I'm
packing up.
kidding.
I have
I'm
a,
kidding.
yeah.
Yeah, it's been one of our later meetings.
Oh.
We've been doing pretty good.
I think it went pretty well.
Yeah.
That's,
Considering
that was a no-win topic.
Well, I think it was important to hear people. And I really think that's very important.
Yeah. All right.
See you Friday.
So I'll make a motion to adjourn.
Second. Oh, let Jeff have it.
All those in favor of adjournment, please say aye.
Aye.
Good night.
I think we should say, all those in favor, say hip